Ayurvedic physicians actually use trifle and trimmer to treat obesity or diabetes. And then we do systematic, well-planned clinical studies on these drugs and the conditions associated with either obesity or diabetes, like PCOS, NFLD. We evaluate the drug in different age groups, and we also study some of the drug interactions. Like when we give any drug, our herbal drug, uh, it is important to prove its safety also, and safety not in terms of effect on liver function or renal function, but how it interacts with the other drugs which patient might be taking, like anti-diabetic, anti-platelet, anti-hypertensive. So whether Triphala interacts with these drugs, this is also area of our interest. But today, the two studies which I'm going to present to you is one on therapeutic course of Takrabasti, that is enema with processed buttermilk in obese individuals. I'm not going to read this introduction, though I have written here, but our focus was on gut microbiome. Takra is, or buttermilk is, a probiotic, and that is why we thought that we should study that whether it affects the gut microbiome, which is changed in obese individuals and thereby reduces the weight. And for that, we studied this whole course of 16 Takra Bastis. And Takra Basti, I mean, Takra is given as a Anupan or many Ayurvedic medicines, but it is not used in a rectal administration form or Basti form in obese individuals. So that was the novelty of the project, and we prepared the Takra, and we also added these 8 plants as a prakshep, and then we gave the basti for 16 days. Of this 15, sorry, of these 15 basti, first 8 and 15 basti was of sesame oil, because takra can cause rukshata at times, dryness in the body. So 3 basti were of sesame oil, and then other all bastis were takra basti. We treated this as a kala basti crop, and then we gave the basti, and next assessment we did on day 16 immediately after the basti treatment. And then on the 30, after 30 days, that in between we didn't give any basti, any treatment, but we just followed up these patients after 30 days, that what happens to them. And at all these time points, that is before starting basti, after finishing the course of basti, and then 30 days later, we did their anthropometry, sugar, insulin, lipids, and of course gut microbiome. So that was studied from stool samples, and 16S RNA is a technology which we use for assessing the gut microbiome. This paper is published. Those who are interested can read this also. So what we observed that in case of anthropometry and circumferential measures, in case of weight, there was not much difference. You can see that from 85.4, the weight was reduced only to 84.84. So we cannot say that actually there was a decrease in weight or BMI. Even visceral fat, body fat percentage, skeletal muscle mass, not much improvement was seen. There was some improvement in waist circumference, I mean circumferential measures. Waist circumference, you can see that there was 6 centimeter decrease in the waist circumference, 5 centimeter in hip circumference, and the skin fold thicknesses also reduced. So it gave us idea that Chakrabasti might be working on the fat deposition. It may be rechannelizing the fat depots, and it may be working like redistribution of the fat. So beta oxidation may be a phenomenon which may be working in this case. Interestingly, when we studied like what happens to insulin and sugar, because they were also of our interest, and we could see that after 16 days of basti, in each individual, insulin levels were going high. I mean, insulin was increasing. First, we thought that it might be because of insulin resistance, because insulin is going high, and we were expecting that sugar will also not reduce, and that will be a classical case of insulin resistance, hyperinsulinemia plus hyperglycemia. But to our surprise, sugar was going down, and it was going down to such an extent that on day 45 also it went down, even without a course of basti. And on day 45, it was statistically significant different than day 0. So definitely it was not an insulin resistance, but then we labeled that it may be insulin secreting activity of basti, which we couldn't work on further because we wanted to do some GLP-1 receptor studies and all, but we couldn't do it. But this is a preliminary observation that insulin levels, since they are going high, this must be a insulin secretory activity. Now coming to the microbiome analysis, which was the most interesting and important part of the study, we could see that now you can see that there are three boxes, and in each box there are three bars. So the red bar in each box is of day 0. The green bar is of day 60, that is after finishing the course of Basti, and the blue bar is of day 45, that is without treatment, which when we allowed patient for 30 days, what happens. And you can see that in each of these three boxes, the red box, the red bar and blue bar are looking similar, whereas the green bar is different in all the boxes. Now, these all three boxes represent different kind of analysis of gut microbial diversity. But whatever analysis we used, we could see that there was some microbial diversity at day 0, which was changed on day 15, that is immediately after Basti, but it came down to the baseline level after the no intervention period. So we concluded from this study that maybe we have to repeat the course of Basti after a certain time period, or maybe we have to prolong the duration of the Basti. And the same thing we observed at phylum level, genus level. So this was just a diversity, that how many bacteria are there, how many types of bacteria are there. But you can see like the here you can read that day 0 and day 45 are almost similar at phylum level, even at genus level. So whatever change was happening after Basti was coming down. But interesting thing is Basti was doing change to gut microbiome, and we should pursue this lead and maybe increase the duration and repeat the course of Basti after certain time period, so that we can achieve and maintain the changed level of gut microbiome. So this is the first study which I thought I should discuss with you. And the second study which I want to discuss with you is a study which we recently finished, that is effect of yoga interventions on skeletal muscle linked glucose homeostasis in pre-diabetic individuals. So glucose homeostasis is skeletal muscle linked glucose homeostasis is important phenomenon, as we know that adipose tissue, liver and muscles are the main organs which dispose the glucose from the body, where skeletal muscle plays 80%, 80 to 80% of the role is played by skeletal muscles. And when it comes to yoga, we often say that yoga must be working on our nervous system, on our mind. It must be activating the parasympathetic activity, and thereby it might be reducing the stress levels and then thereby reducing the glucose levels. But we thought that why not to think the physical activity part of the yoga, and whether it works on the skeletal muscles and thereby increases its activation and then improves the glucose homeostasis by that mechanism. And this was the basic hypothesis. Otherwise, yoga is well proven in pre-diabetes and diabetes, but this skeletal muscle linked glucose homeostasis was the novelty of this particular project. And I have deliberately brought this slide to show you, because this may be your observations also. We approached 850 individuals in the community and could actually screen only 232 individuals. And in these 232 individuals, we found accidentally diabetic patients because they were not knowing that they are diabetics. They just came for our study, and our study was in pre-diabetics, so we couldn't recruit them. There were patients with high levels of thyroid hormones, abnormal ECGs. So ultimately, we could get only 96 individuals who were normal, and we could screen. Actually, they were eligible to take part, and then of them we could recruit only 42, because again there were some issues like why they don't want to come. And ultimately these 42 individuals, so we started from 850 and we boiled down to only 42 individuals, and then we randomly divided into them into two groups, yoga and exercise. So exercise was a gym based protocol, and yoga was a protocol which is designed by S. Vyasa University for diabetics. And this study was done during the COVID days. So started in COVID days. So it was very difficult for us to continue with such kind of studies during COVID. People were not ready to come for screening also. So somehow we managed to convince people, and following all the social distancing and everything, we did this recruitment. And of these 16 and 9, so 42 recruited and completed 25. So almost 45% dropout rate was seen. So how difficult are the studies with lifestyle interventions? That is what I just want to highlight from this slide. Uh, that when people say that you should do lifestyle intervention studies, it is not that easy, and that has to be highlighted somewhere. And as I said, that the important part of this was to study the effect of yoga on skeletal muscle link glucose homeostasis. And then we did different experiments on these individuals pre and post study. There was muscle strength studies, muscle endurance studies, muscle flexibility studies. And in all these studies, the red line, wherever you see in these graphs, is of exercise group, whereas the blue line is of yoga group. And yoga group has also done equally good in case of hand grip strength, though not so good in terms of leg strength, because we know that exercise has lot many components: jogging, walking, running. So these cannot be parallel to the yoga, but otherwise hand grip strength was equally increased. And the interesting part which we could observe is yoga could bring the difference even at 30 days. So if whatever star you are seeing at day 30 is at yoga group, and yoga group has shown improvement after 30 days also. So it starts showing improvement as early as 30 days. And this was a consistent finding at all levels. You can see at muscle endurance, push up, pull ups, dips, squats. So at everywhere, you can see that yoga group was doing as good as exercise. And the best part of this whole thing is exercise is gym based exercise. So you need facility, you know, need people have to go there. Yoga is something which people can do, sit at home and do, and there is no external things required, no apparatus, no equipment, and that is also giving equal results. So and this was an interesting finding which we got. In flexibility, of course, we have expected that yoga will show more flexibility, and that is what we have seen. Again, on 30 days only, yoga started showing the results. So yoga, in short, improved all the muscle related parameters. That was our hypothesis. Now next part was like whether this muscle improvement, muscle quality improvement is seen in the glucose homeostasis, or whether we can associate these muscle improvement with the glucose improvement, because that was the hypothesis. And when we analyze the data of glucose homeostasis, you can see that there was no significant difference in either of the group. In case of any of the parameters, FBG, fasting blood glucose, HbA1c, insulin, OMA-IR, OGTT, OGTT, after 2 hours, not much difference. And then when I looked at this data very carefully, I realized that though we included pre-diabetic individuals, on the basis of HbA1c percentage, you can see that they were just on borderline. Their HbA1c was just 5.92 or 5.82 in other group at baseline. So that means they were recently become pre-diabetic, or they were on the borderline. Anyways, not much difference we can expect this, because there is a theory of regression of mean, and many of you might be knowing that when the levels are high, they drop also very fast. But here there was not much improvement, and this is a lesson which we got, that by default we included all pre-diabetic individuals as per the definition of pre-diabetic, but they were on such a borderline level that we couldn't see any difference in their glucose levels, and that is why we couldn't associate the findings with muscle quality improvement. So this is somewhat negative kind of result, you can say, but the positive finding of this is that we could show that yoga can improve the muscle quality. And this finding, if we implement or imply to the diabetic patients, who means whose glucose levels is absolutely in the diabetic range, maybe we will be able to see the difference even in the glucose levels. So these were the two studies which I wanted to discuss with you, and I think I will stop here. Once again, thank you for inviting me, and I'm sure that we will continue the discussions and collaborations even after this symposium. Thank you very much.
Uh, Thank you, ma'am. When you can share, a result, a research work on a negative result and find something positive out of that, I'm sure a lot of presenters who have not presented this year will, and are in the viewers list, will also come forward and present in the next year's symposium. With this, I call upon Dr. Omkar sir who is the head training department of Madhubag. And that, as such, we don't need any special introduction for him. But although I would be introducing him, he's associated with Madhubag since the last 16 years, and he's the head of learning and development department. He has trained more than thousands of doctors till of Madhubag till date, and has taken more than 500 public awareness sessions. Last but not the very least, he's a crazy person who is in love with Ayurveda since the first day of his college life. Sir, the stage is all yours.
Yes,
Kindly share a few words with us.
thank you, Dr. Jinal, for your generous words. And I just a minute. Okay, just a minute. Yeah, fine. And I'm really honored. We all are honored to have Dr. Supriya Bhalerao, madam, today for this session of NACS. And it's really great to have you, ma'am, today for this interactions. As most of our doctors, if you see, all of them are physicians, clinicians, and out of their busy schedules, they are going to present their achievements in front of such a big dignitary like you. And obviously, I will like to take this opportunity to thank Dr. Rohit Sane sir and Dr. Rahul Mandole sir, who has given this stage to all the energetic, enthusiastic presenters, so that their scientific achievements are being put forth in front of all the dignitaries, and all the parametric improvements which Madhubag is known for has been displayed in front of all, so that the younger generations of Ayurveda can definitely cherish new achievements, and they'll be more focused in the field of research. So thank you, Supriya ma'am, to be the chairperson and speaker for today's event. And Rahul sir, once again, thanks a lot. And I will request all the presenters over here, 7 o'clock is a time, Vatakal hai 2 se 6, right? But all of you have to show your energy levels. You have just 5 minutes of time, and 5 minutes are quite good enough to present your achievements regarding the hard-earned patient improvements. 1 more minute will be given to all of you, so that definitely we'll have some discussions. Whatever points Supriya madam or I point out, we want those answers from your end, because the case presentations obviously are quite awesome. Now, in last 2.5 days, we have seen around 65 presenters with different kinds of topics like AVN, we had PCOS, we had hypothyroidism, CHF, myocardial bridge, atherosclerotic plaque. So n number of metabolic syndrome disorders have been taken care by all of you, and you have presented the data so well that even MBBS doctors throughout the world who have joined in last 2.5 days, they have really applauded your achievements. And definitely we see something, a good kind of an amalgamation between Ayurveda and modern science, so that the future generations who come in Ayurveda field will really feel proud. So best of luck to all the doctors who are here, and all the 13-14 presenters who will be sharing their knowledge and experience about the patient improvements. Dr. Jinal, over to you, because all have come to hear the research presentations. I'll be with all of them throughout their journey. So I hand over the session to you, ma'am. Dr. Jinal.
Thank you very much, sir. Indeed, all of us are eager to start the presentations so that we can understand what each of us are doing. So firstly, I would like to call upon Dr. Jayashree Arora for her presentation. Ma'am, the stage is all yours.
Yes, Dr. Jayashree, ma'am.
जी
Good evening.
ऑन करो भैया, प्लीज इधर आइए भैया.
Ma'am, you are audible and we can see you. If you have sent the presentation to Pallavi madam, she can share the presentation for you.
Sir. Madam, I will take some time. If there is
Jayashree madam, your presentation is on screen.
Is on the screen.
And you can start with your presentation. You have 5 minutes time with you, ma'am.
Sir,
Sorry, can you hear me?
can you hear me? Bolo.
Yes, you're audible.
Yes. Ma'am, namaskar. This is the PIH case associated with antenatal complication, treated with herbal medicine. Next. There are two cases. One case is 31-year female having a 7-month amenorrhea. She came to me, complained of edema, pain in abdomen, nausea, bilateral edema, pedal edema. Since 1 week, there is no history of trauma, bleeding, leaking, and any other. Menstrual history is 26 January. EDD is 2/10/22. Obstetric history is G5P3A A2L1. 1 full term, normal delivery, 2nd is stillbirth, and 2 preterm level. History of PIH and prior pregnancy. Same case as second case is same. Only obstetric history is different. G2P1L1. Both cases in past, both cases having complicated pregnancy and outcome. Sir, this time I treated and patient next. Actually, जो treatment था during pregnancy, first and second, third trimester, मासानुमासिक क्रम में treatment दिया और case is same कि in first case vomiting and in the second case antenatal care में जो pregnancy जो antenatal periods के जो symptoms होते हैं वो सारे कुछ थर्ड ट्राइमेस्टर में यूएसजी में पेशेंट का जो प्रीवियस प्रेगनेंसी में कॉम्प्लिकेशन थे IUGR ओलिगोहाइड्रोएमनियास इस प्रेगनेंसी में वो सब प्रॉब्लम्स नहीं थे सेकंड केस भी सेम था कि फर्स्ट प्रेगनेंसी में IUGR था ओलिगोहाइड्रोएमनियास और इस प्रेगनेंसी में हमने मासानुमासिक मेडिसिन के साथ उसे ट्रीट किया नेक्स्ट treatment is given first and second trimester, folic acid, iron, calcium. Ayurveda से Medya Rasayan and Medya Rasayan दिया धात्री लॉ प्रजा स्थापनी कुकुटान त्वग्भस प्रवालपिष्टि मधुमालिनी U4 एक मासानुमासिक वृद्धि क्रम के ड्रग्स थे और थर्ड ट्राइमेस्टर में डायूरेटिक्स पुनर्नवा गोक्षुर पाषाण नेक्स्ट बेसिकली टारगेट था कि जो कॉजेज होते हैं प्रेगनेंसी इंड्यूस्ड हाइपरटेंशन के तो उसके ट्रीटमेंट के अकॉर्डिंग हमें एंजियोलाइटिक टोकोलिटिक डायूरेटिक अल्फा ब्लॉकर्स का कॉम्बिनेशन देना होता है अकॉर्डिंग टू मॉडर्न आयुर्वेद से भी हमने सेम मेंटेन किया Punarnava, first drug, suppose Punarnava, which can be used in relieving urinary retention and by edema. Gokshur is known as effective treatment of all urinary tract related disorder.
Madam, you have last 1 minute.
Fibrolytic, thrombolytic, antiplatelet, antihypertensive drugs दी गई शुंठी ब्राह्मी like a anxiolytic drug calcium channel blocker जो कि premature labor को भी prevent करता है ये हमने दिया next ये फर्स्ट एंड सेकंड सोनोग्राफी है फर्स्ट केस की जिसमें कि हमने जो फर्स्ट उसका बेबी था वो 1500 ग्राम का था और इस टाइम एक केस में 900 ग्राम और सेकंड केस में 2.2 kg बेबी वेट था जो कि फर्स्ट प्रेगनेंसी से बहुत बेटर था और APGR एपिगार जो थे साइन गुड रिफ्लेक्सेस क्राई ये सब कुछ बेटर था प्रायर प्रेगनेंसी से और नेक्स्ट सेकेंड केस में यूरिन मतलब जो एग्जामिनेशन वाइज एल्ब्यूमिन जो हमारा मेन इंडिकेशन होता है वह भी नॉर्मल था BT CT SGOT SGPT ऑल आर नॉर्मल नेक्स्ट सेकेंड केस में भी ऑलमोस्ट सारी फाइंडिंग्स नॉर्मल थी। सेकेंड केस जो था उसकी हिस्ट्री में एंटी डिप्रेसेंट ड्रग में पेशेंट थी। इस बार वो ड्यूरिंग प्रेगनेंसी एंटी डिप्रेसेंट ड्रग नहीं लिया गया। फर्स्ट फर्स्ट प्रेगनेंसी नॉर्मल डिलीवर हुई एंड सेकेंड प्रेगनेंसी में सीजर लिया गया। बेबी इज वेल। सेकेंड नेक्स्ट। According to sonography, condition is better than prior pregnancy. Next.
Ma'am, I would ask you to conclude your presentation.
Next. Outcome, first male child 2.7 kg and second is 1.5, but having good upper guard, good sign and symptom for baby. Next. Thank you so much.
Dr. Supriya ma'am, if you have questions for the presenter.
No, first of all, I would like to congratulate the whole concept only, that how the clinicians are presenting their cases, and this is a way like how we can inculcate the research spirit in them. So this is, first of all, I would like to congratulate all of those who have thought of this. I would just like to ask Madam one question. Madam, you have nicely mentioned why you have used the drugs, and you have given like fibrinolytic or some activities from modern medicine, that antidepressant, anxiolytic, whatever. But when you gave it from Ayurveda perspective, what was your thought? Because you might not have that time check the activities which are reported pharmacological activities of these plants. You must have used them with some Ayurveda thought. So if you would have shared that thought, it would have been more interesting.
Yes, मैम एक्चुअली ये था कि पुनर्नवा गोक्षुर का कॉम्बिनेशन इंडिकेटेड था, और मोड ऑफ एक्शन इज सेम, मूत्र जनन, मूत्र विरेचक, एंड गोक्षुर इज गुड फॉर जेनाइटल एंड urinary tract system. तो बिकॉज ऑफ दिस प्रॉपर्टी ये ड्रग हमने यूज किया। सेकेंड, ब्राह्मी इज गुड फॉर एंटीनेटल पीरियड एंड एंजियोलाइटिक। मॉडर्न में हमारे पास ऐसा कोई कॉन्सेप्ट नहीं होता है, क्योंकि वहां पे तो हम कुछ भी सेडेटिव ड्रग नहीं दे सकते। तो ये हमारा एक गुड पार्ट होता है आयुर्वेद में कि हम ब्राह्मी देते हैं। एंड टोकोलिटिक एजेंट जो कि प्रीमैच्योर लेबर को प्रिवेंट करता है, इसके लिए भी हमने जो ड्रग दिए हैं वो एंजियोलाइटिक एजेंट होने के कारण, अश्वगंधा होता है, ब्राह्मी होता है। तो ये ड्रग ने ये हमारा कॉन्सेप्ट था कि हम उस एंजियोलाइटिक एक्टिविटीज को भी प्रिवेंट कर सकते थे। और थर्ड वन मैडम डायूरेटिक था। IUGR प्रिवेंट करने के लिए भी अश्वगंधा बहुत अच्छा ड्रग होता है। तो ये हमने इस कॉन्सेप्ट से यूज किया मैम। और आयुर्वेद में जो मासानुमासिक निर्देशित है, बेसिकली यही कॉन्सेप्ट था, बट उसे कंपेयर किया, और ड्रग हम बहुत लंबे समय तक एंटी हाइपरटेंसिव भी, और मैडम इसके अलावा जो हम एंटी प्लेटलेट्स ड्रग यूज करते हैं, इकोस्प्रिन जो हमारा मेन ड्रग होता है, यूजुअली जब ये प्रॉब्लम्स होते हैं तो रेट्रोप्लेसेंटल क्लॉट होता है, और उस समय हम ये कोशिश करते हैं कि हम ऐसा कोई ड्रग यूज करें। तो वो एक टिपिकली एक ऐसा ड्रग हमारे पास होता है कि हम उसे एंटी प्लेटलेट एंटीकोएगुलेंट इफेक्ट कर सकते हैं विदाउट एनी साइड इफेक्ट। तो बेसिकली हमारा कॉन्सेप्ट ये था कि हम जितना आयुर्वेद ड्रग यूज करते हैं मासानुमासिक, सेम मॉडर्न हम अगर कर रहे हैं, तो हमारे पास वो एक पूरी ऑलरेडी एक लाइन ऑफ ट्रीटमेंट हमारे पास है जिसको हम फॉलो कर सकते हैं। तो इस तरह हमारा ये कॉन्सेप्ट था इस ड्रग को फॉलो करना आयुर्वेदिक द्रव्य गुण वीर्य विपाक के अनुसार। Any question?
Ma'am, any other question?
No, not from my side. So, do I have to announce the scores right now or at the end of?
No, madam. What you can do is you can send the scores of each presenter to me in personal chat, and will be announced at the end.
Sure.
I would like Dr. Omkar sir, if you have any questions for the presenter.
Yes, Dr. Jayashree madam, superb results. Because see, ultimately a patient comes to a doctor with blind faith that he is going to get all the Phalashrutis, right? And obviously both these cases, which we have done is just superb results. No doubt about, no questions. Just one suggestion, ma'am. Whenever we are presenting any kind of a research presentation, do not disclose the name of the patient. This is one thing, suggestion from my end to all the presenters. Please do not disclose the names of the patients, right?
Sorry, sir.
We are on a live stream now, right? And it doesn't look good, right? As per the ethics shared by Rahul, sir, I think, sir, I've pointed out the right point. Right. So overall, it was a fantastic presentation. No, don't be sorry, ma'am. Just make this improvement in the next presentation whenever you are going to present in such a big symposium. Right. Best of luck and superb results. Okay. Yes, Jinal madam, over to you.
Yes. Thank you once again, Dr. Jayashree. I would now like to call upon the second speaker for the evening session, Dr. Supriya Bhalerao. Ma'am, the mic is all yours.
Am I audible?
Yes, ma'am.
Hello, everyone. I'm Dr. Sumara, Madhobag Dhantoli Clinic, Nagpur. Today, I am representing...
Just a minute. Your PPT is not visible, madam.
Levi, madam, if you can share the same presentations, we can save some time. Yes. Thank you, Pallavi, ma'am.
Hello, everyone. I'm Dr. Sumara. My topic of research is retrospective analysis of impact of dietary management in chronic heart failure treated with Panchkarma. Next. As we are regularly dealing with cardiac patients, we commonly encounter case of heart failure. The management of this patient comes through its own set of challenges. The impact of Madhobag Sampurna Hrudaya Shuddhikaran therapies has already been established in the cases of heart failure. So we will evaluate an additional impact, low carb, low calorie diet with high ORAC value in furthering the scoping of improvement. We do this with a retrospective analysis of outcome in two groups of demographically similar patients, where one was put on our diet box while the other followed general diet instructions. Next, please. As we know that the Madhobag diet plan is high ORAC value, that is 65,000. Vitamin C is more than 500 grams per day. The product are fortifying with medicinal herb like ashwagandha, triphala, and vidarigan. Low glycemic index food, low carb, high protein, and good quality of fat. Vitamin C, vitamin E, omega fatty acid, and potassium rich. And the calorie values of this diet box is 14,000 kilocalorie. Next, please. So here we planned 50 patients in two groups. In first group, we planned 25 patients treated with SHS with 1,000 kilocalorie regular diet chart. And the second one, we planned 25 patients treated with SHS with, that is Sampurna Hrudaya Shuddhikaran with 1,000 kilocalorie Madhobag diet plan. Including criteria is patient of age group 40 to 75 and VO2 max lower than 20 minutes. And by HA grade second and third. Next, please. As we know that VO2 peak is a very strong and independent predictor of cardiac morbidity and mortality. Keep this in mind, we plan an observational study to analyze the effect of low calorie, low carb, and resource of antioxidant Madhobag diet on VO2 peak in patients of heart failure treated with heart failure reversal therapy treatment. Next, please. So here my primary endpoint is VO2 peak, and the secondary endpoint is weight, BMI, abdominal girth, heart rate, systolic and diastolic blood pressure. Next, please. Here we plan 6-minute walk test TMT for VO2 peak, systolic, diastolic blood pressure measuring in day first, 21 Panchkarma done in 3 months with 1,000 kilocalorie diet plan. All these tests done by day 1 and repeated by 30, 60, and 90 days. Next. So we know, everyone knows that this HFRT, that is heart failure reversal therapy, is 4-step procedures in which we are done Snehana, Swedana, Ridedara, and Basti. Next. So here the group 1, which is on heart failure reversal therapy without diet box, the improvement in this patient are 41. VO2 max is improving in percentage is 41.38. The weight in patient is reduces by 5.56. BMI is reducing by 5.86. Heart rate is reducing by 9.35, and systolic blood pressure reduces by 9.46, and diastolic blood pressure reduces by 6.63. Next, please. In group second, treated with heart failure reversal therapy with diet box, Madhobag diet box, the improvement in these patients are 68.02 in VO2 max, weight is reduces by 13.22, BMI is reduces by 13.52, heart rate it reduces by 15.36, and systolic blood pressure it reduces by 13.68, and diastolic blood pressure it reduces by 15.86. Next, please. So here we in say both group we planned t-test, and the p-value of both group is 0.01. That is significantly improvement. But the improvement in second group is more than the improvement in first group. The VO2 max of first group is improving by 51, where the second group is improving 68. Weight is reduces in group 1 is 68, and group second it is improving by 13%. The second BMI of group 1 is improved by reduces by 6, and in second group it is reduces by 14%. Heart rate in group 1 is reduces by 9, and then in second group it is reduces by 15%. Systolic blood pressure in group 1 is reduces by 9, and diastolic blood pressure reduces in group 1 is 7. Systolic blood pressure in group 2 is improving by 15%, and diastolic blood pressure it reduces by 15%. So next, please. So the conclusion is that the present observation study analyzes the effect of heart failure with ideal diet plan in patient of heart failure found that there was a significant improvement in VO2 peak from day 1 to day 90, where the changes in VO2 max improve the prognostic value of our long-term survival and significant impact of mortality risk. And we know that some researchers say that if we around 14 to 16% reduction in risk of mortality with increasing in VO2 peak by 1 ml per kg per minute. So thus, next please. So here we have to think about that, and we know that the CHF is such a high, such a complicated disease in which other complication like high blood pressure, heart disease, and kidney.
Ma'am, I'd like you to conclude.
Yeah, treatment of CHF help to prevent complication and reverse its symptoms. So next, madam, please. So my results of this patient, in this 50 patient, there in 25 patient, there was a significant improvement in group 2. The weight of this patient, it reduces by 9.42 in 90 days, and the VO2 peak from day 1 to reduces by 14.11 to day 90. So the conclusion of my conclusion of on this study is showing that heart failure reversal therapy and low carb 1000 calorie ideal diet has been found to be a potent, viable, and patient for heart failure, reducing VO2 peak, in improving TMT examinations. Thank you so much.
Dr. Supriya ma'am, any questions for the presenter?
Yeah, not questions, but just two suggestions. First is when you show the results average, so there is something called as standard deviation also, because not every patient will be scoring exactly same percent, same values. So there will be some variation. It is not like every patient will have the same value and then average comes exactly the same. There is like 2, 4, and 6. When we take average, then it comes 4, but one is 2 digits away, and one is 2 digits behind, and one is 2 digits ahead. So we have to have a deviation, and your statisticians at Madhavbag will help you for calculating this standard deviation. This will make the presentation better and more scientific. This is my first suggestion. And the second suggestion is what references you have showed. There is a style of writing references, and I'm sure Dr. Omkar will take care of this thing from his learning center, training center. So a simple thing like how to write references that will make your presentation more scientific, but otherwise it was absolutely fantastic and amazing to see how the results. The diet kit is giving the results. So this is just to make your presentation more better.
Thank you, ma'am.
Thank you, ma'am, for your valued suggestions. Dr. Omkar, sir, any questions for Dr. Sumaira?
Not exactly any questions, because all the trophies behind Sumaira ma'am's faces, it's a self-explanatory thing that she's an achiever in Madhobha, and n number of patients have been treated successfully by her. Just one question, ma'am, out of curiosity: if 100 patients of chronic heart failure come to you, for how many patients will you use HFRT plus diet box, and how many will you use only Panchkarma treatments?
So maximum we are trying 99.9% patients should take diet box, because we know the results of diet box we are given to patient. As we know that normal diet is only contain 3000 ORAC values, where our diet box is contain 65 ORAC values. So this is the 65,000 kilocalorie ORAC values. So that is the most different between this different in normal and our diet box. So that I will definitely suggest patient to take, and we are doing exactly these things in my clinic.
Perfect, ma'am. Fantastic presentation overall, ma'am. Super.
Thank you, sir. Thank you.
Yes, Jinal ma'am, over to you.
Yes, I would now like to call upon our next presenter for the evening, Dr. Anand Ulhe, sir. Dr. Anand, the mic is all yours.
I request to Pallavi ma'am, please share my PPT. Good evening, Supriya ma'am and Omkar sir. Am I audible?
Yes, doctor, you're audible. You can go ahead.
My case study is for role of Panchkarma and Ayurvedic medicine in ischemic heart disease. I am Dr. Anand Ulhe, clinic head, Madhavbagh, Ratinagar. Objectives of my case study is ischemic heart disease is life-threatening disease and #1 killer in India. Although several treatments of ischemic heart disease are available, yet mortality rate is not decreased but increasing. So I wanted to study, does Ayurveda have any role in treating ischemic heart disease? Next. A male patient, 67-year-old, retired lecturer, weight 66 kg, resident of Amravati. This is ischemic heart disease, hypertension, and diabetic. Past history CABG done in 2009 and anterior wall MI and inferior wall MI in 2018. Present complaint is chest pain on walking, tingling and pain in left hand. Diagnosis: according to stress test, patient walked 5 minutes 18 seconds on treadmill, obtaining report of anterior wall ST elevation and VO2 max of 11.2. So he was diagnosed with ischemic heart disease and known case of hypertension and DM. Treatment: I have started with low fat, low carbohydrate, high protein and high fiber diet. Medicines: combination of Arjuna, Vacha, Patha, Twak, Bibhitak and Punarnava for 3 months. In addition to that, Gokshur, Haridra, Amalki given for 3 months. Panchakarma done with Abhyanga with Til Tel and Neem Siddha Til Tel, Swedan with Dashmul Kwat and Basti with Gokshur, Haridra, Amalki. 14 sittings for 3 months. Result: complaint of tingling in left hand decreased from grade 6 to 0. Dyspnea on exertion was decreased from grade NIHA grade 3 to 0. According to before and after stress test, VO2 max increased from 11.2 to 25.55. Before stress test report shown anterior wall ST elevation, and after treatment stress test report shows no ischemia noted. These are the two reports, before treatment and after treatment. Next, please. Next slide, please.
Yes, sir, you can conclude your presentation.
I think he has lost connection.
Yes, he's lost the connection. We'll just wait for.
Yeah, he's back.
We can reverse ischemic heart disease with the help of low carbohydrate, low fat, low protein, and high fiber diet, and Ayurvedic medicine and Ayurvedic Panchkarma treatment. Thank you.
Yes, Dr. Supriya, if you have any questions for Dr. Anand.
Yeah, I have a question which may sound little
Yes,
funny, but it is a genuine question because I am not aware that what are the maximum values of VO2 max a patient can achieve.
Ma'am, 30 and above is the normal values for healthy person. And and actually in COVID period, we find that VO2 max less than 15 is more chances of morbidity in patients. So more than 15 is for healthy person.
Yeah,
But
in healthy
30 and
also, whether there is any age-wise difference because this patient was quite old patient. So age-wise also, are there any differences in VO2 max values?
Yes, ma'am. But it is on exercise.
Okay.
Depend on exercise. Yes, ma'am.
Basically, ma'am, in females, VO2 max above 30 is considered as a good VO2 max value, maximum volume of oxygen consumed during maximum intensity exercise. In short, it's the aerobic capacity. And in males, it is considered by 35. So, and as Dr. Anandulle told, a VO2 max less than 15 ml per kg per minute is considered to be a highest mortality ratio. So now in his presentation, what he is trying to show is that VO2 max has improved up till 25, if I'm not wrong, Dr. Anand.
Yes.
So obviously the risk of future cardiovascular events have decreased through the line of treatment.
Yeah, so such things you can highlight, so it will make it more interesting.
Perfect.
Otherwise, it was a nice presentation, and it is really difficult to give marks to anybody.
Yeah, ma'am, although it is a difficult task, you have been assigned the task today.
I have to do it.
Dr. Omkar sir, I would like if you have any questions for Dr.
Yes,
Anand.
one question, Dr. Anand. Was any 2D echo with GLS done in this case, as this case was an IHD case, ischemic heart disease case? Usually we go for 2D echo with GLS.
2D echo with GLS is not available that time in Amravati. Now it is available. And patient is not agree to go to Nagpur. So
okay. Yes. But now that the facility is available in your country, definitely in future cases you can use that, so that it will be always preferred that you use two parameters to show the parametric improvement. One obviously is in your clinic, that is a stress test, and the other if 2D echo with GLS report also comes along with the stress test report. So it will be easy for you to show the pre and post results scientifically in front of all the communities. Right? Overall, the presentation was superb. Fantastic. Yes, Dr. China.
I'm sure Dr. Anand has taken notes. I would now like to welcome Dr. Pallavi Pawar and Dr. Diwakar Pawar for the presentation. Dr. Pallavi, the stage is all yours.
Thank you, gentlemen. Good evening, all the dignitaries and all my friends. Here, myself, Dr. Pallavi Pawar from Madhavbag Medical Square, Nagpur branch. With me, Dr. Diwakar Pawar as a clinic head. Today, I am going to present a case study, role of glycemic control and weight loss. Sorry, sir. Role of glycemic control and weight loss in non-alcoholic fatty liver disease, NAFLD. Objective is to study, does glycemic control and weight loss are helpful remedies in non-alcoholic fatty liver disease? Introduction. Now, what is NAFLD? It's defined as excess fat accumulation in liver, which is usually occurs in diabetic, hypertensive, and disturbed cholesterol level patients. These disorders often run together, and we may call them a metabolic syndrome. And now, how that fat can damage our liver? Here is two pictures. One is above, you can see healthy liver, and below that you can see fatty liver. From that, you can surely and easily assume that what can the fat damage to our liver. So in some people, the excess fat sits in liver but may not cause any liver damage. But in 5% of people, it may cause severe damage to liver, that is, the condition is non-alcoholic steatohepatitis or NASH. Steto means to related to fat, and hepatitis means the inflammation of liver, which may further lead to a serious condition like liver fibrosis, liver cirrhosis. And this, in this case, present case, liver fibrosis was at grade 3 to 4. And this is my case. A 52 years old male patient came to our clinic in January 2023, who is already diagnosed as an FLD with liver fibrosis. Known case of type 2 diabetes, hypertension, obesity since 10 years, and NFLD since 6 years. He was on tablet Telma 40, tablet Olimprix 20 mg OD, tablet Glimulin 2 mf VD, tablet POS 15 mg OD, injection Lantus 24 unit HS, and tablet Ecosprin 150 mg OD, capsule Ecopep 100 mg TDS, lactic fiber powder in 50 gram HS, and tablet Mitaz with capsule Smazmo, Proxion, SOS. And he was presented with a complaint of nausea, abdominal distension, severely constipated, abdominal pain, anxiety, and he was expecting from us that he should have weight loss, weight control of diabetes, and to get rid of his symptoms of liver disease. The patient had been assessed on different clinical and laboratory parameters like heart rate, BP, ECG, random sugar, HbA1c, lipid profiles, LFT, liver fibroscan, weight, height, BMI, and abdominal girth. On examination, his heart rate was 99 per minute, BP 120/80, RBS, random blood sugar was 152 mg per dl, and his day 1 weight was 81.4 kg and BMI 26, and abdominal girth was 103 centimeter, as HbA1c is 8.8%. And he came with reports of UAG abdomen with suggestive of severely altered pattern, chronic liver disease, and hepatomegaly and splenomegaly. Yeah, autistic radiation for force impulse test, he is having score 1.52. It should be below 1.5, and fibroscan report suggestive of severe NASH, that is non-alcoholic steatohepatitis. His CAP score, which is called as controlled attenuated parameter, it was 255 decibel per meter. It would always in 100 to 400 in a range. When it is 233 to 260 decibel per meter, we may call that his 11 to 33% liver has been damaged. And now this patient has 255 decibel per meter CAP score. So we may say that he is having 30 to 33% of his liver damage, and his fibrosis score, which should be 2 to 7 kilopascal, it was 16.7, means severely fibrosed liver. We go with him with the treatment and diet advice: 18 Snehan Swedan Basti therapy, Brida Virachana, polyherbal oral medicines, diet plans according to BMI, 800 kilocalorie carb diet, high fiber diet with green vegetables, selective fruits, because all type of fruits cannot work here, and restricted water intake, no aerated drinks and fried foods. This is the treatment information, oral medicine, diet, and Panchkarma. This is a timeline of treatment. Day 1 weight was 81.4, BMI 26, abdominal girth 103 centimeter, HbA1c 8.8, and in month of May, it's 73 kg weight, BMI 23, HbA1c 5.7, with no complaints at all.
Ma'am, last 1 minute.
Day 1, nausea, distension, pain, constipation, but after 90 days, it was complaint free, and weight loss 8.4 kg, exactly 10% of his day 1 weight, and abdominal girth reduces by 13 centimeters. So distension, it suggests that distension subsided. Day 1 USG suggesting of hepatomegaly and splenomegaly. Latest USG spleen normal, liver normal in size, parenchymal disease is chronic, so it might be irreversible. All of his allopathic medicines are tapered down, and he is only with metformin 250 mg BD. These all are parametric analysis. Here you can see HbA1c before Ayurvedic treatment, he was continuously growing. After joining us, he is on decreasing path continuously from 8.8 to 5.7. This is day 1 USG and latest. This is FibroScan for day 1 and latest. Here, his elasticity graph suggestive of stiffness 1.52 is suggests fibrosis, and in latest it was 1.7. It again suggestive of fibrosis. Here, today I'm not going to discuss how we reduce the HbA1c and weight of this patient. Rather, the point to be discussed here, what we have achieved by reducing these both the factors. A landmark study showed that losing 10% of one's body weight can reduce liver fat, resolve inflammation, and potentially get improved. Our 8 kilocalorie apatrapanjana ahara with tikta katu kashaya dominancy helps to reduce fat from our body, as well as it reduces fat deposition on our soft organs like kidney, liver, and pancreas. The aim of low carb diet is to force the body to use deposited fat as its main energy source. Due to improved sensitivity of insulin, glucose uptake mechanism get activated and insulin stimulated transfer of glucose takes place, which reduces allopathy drug dependency and overall metabolism gets improved. Our medicines, Gudmar, Amalki, Haridra, Shunthi, Gudwell extract prevents micro and macrovascular complications. Daru Haridra, Kutki, Apamarga, Pipadi, Haritki acts as a Mruduvirechon and as a liver tonic, as well as Daru Haridra is anti-hyperglycemics, which reduce insulin resistance. As a result of this, we get above said improvements. Conclusion. As advised by his gastroenterologist to prevent further liver damage, patient has to lose 10% of his current weight and diabetes control with reduction in medicinal burden. Patient reduces 8.4 kg weight, exactly 10% of his current day 1 weight, reduces abdominal girth by 30 centimeter and HbA1c reduction up to 5.7 centimeter without. Now he is without insulin and OHA, only metformin 250 mg is on. He is not having any complaint regarding the issue, improved symptomatically, and his expectations on day 1 has fulfilled. So from this study, we can conclude that by managing healthy weight and blood sugars level, we can lower down fat deposition built up in liver and get symptomatically and subjectively improved. And by lower down drug dependency, its burden on liver further severe damage like fibrosis, liver cirrhosis, hepatic CA, or hepatitis can be preventable. One more thing we can conclude here, that our diabetes reversal therapy, comprehensive diabetic reversal therapy, which we do regularly, is not only up to the control of one's blood sugar level, but it's up to the prevention of further complications caused by these metabolic disorders and vital organ damages, which is ultimately going to reduce the mortality rate. These are some references. Thank you. And my take-home message is take care of your liver. You only have one. Thank you. Thank you, everyone.
Dr. Supriya ma'am, if you have questions for the presenter.
Yeah, interesting case. I just want to know one thing, like whether the patient was receiving his anti-diabetic or other allopathy medicines, or you discontinued them.
Sorry, ma'am?
Whether you discontinued the allopathy medicines which the patient was taking when he came to you, or whether they were continued.
Initially, he was continuing with that medicines. As he is improving, his allopathy consultants itself decreases that doses, and ultimately he said even his cardiologist had stress test, treadmill test for him, and it was negative. So EcoSprin is off. He was taking digestive enzymes, TDS. So gastroenterologist stopped them, and lactofiber powder he was taking. We are carrying him with our Anulax powder and Amari oil as a Mruduvirechon. So he said there is no need to have lactofibers. So all the medicine, and because of initially he was carrying with his allopathy medicines, 4 type of OH, teneligliptin, glimepiride, Olimprix, then metformin with 24 unit of insulin. He was going in hypo. So there was no need of OH and insulin, so they tapered all that drugs by their side.
Yeah, very good. So you could have mentioned this also as one positive outcome of your
sure, ma'am.
treatment. And secondly, when you say, when you have given a title, I don't know like how you selected the title of your case presentation, but role of weight loss and glycemic control in NFLD management is well-known thing. I mean, if you put this as a title for some cardiology international conference, it will not give you more, I mean, that weightage. But how you reduce it with, or how you control it with Ayurveda medicine, that is the novelty. So you should highlight your treatment aspect rather than saying that weight loss and glycemic control, how they are playing role. They are known factors, but in 4 months time, how you could achieve the things with Ayurveda medicines is something which you should highlight. That is what I think.
Yeah, ma'am. But we are having a research-based particular format. We doesn't do anything beyond that format, and results and outputs of that treatment protocol.
Fine. That is also fine. I can understand what you are trying to say, but still, the Ayurvedic medicines are giving these results.
Yeah,
Whether
exactly,
they are standard, whether they are structured, whether they are given to you, that is all fine. But this Ayurvedic treatment is giving this kind of improvement in 4 months' time. That is something which you should highlight. And this thing like how you taper down the allopathy medicines dose, so the dose requirement also went down. That is also an important finding from your study.
Okay, ma'am. I will improvise that thing. Thank you, ma'am.
Otherwise,
valuable suggestions.
Yeah.
And Dr. Omkar, sir, any questions for Dr. Pallavi?
Yes, Lord Dhanvantari is behind you, so he has the blessings on you. Fantastic case presentation, and the last comment which you mentioned, please take care of your liver, you only have one. That is an icing on the cake. Definitely superb presentation. Only thing, Yakrut being the Moolasthana of Raktava Srotas, what were the dravya which you selected for the treatment? Can you just specify some dravyas which you selected precisely for treating Yakrut Vikar?
Sir, specifically not other drugs, but our drugs, that is linoleum, Nulax, Amari oil as Mrudu Virachan, then NKG powder, which all are going to work as hepatotonic and reduces toxicity which occurs because of hepatic toxins and acids.
So medicines like Kutki, medicines like
Apamarg,
Rohit, Erand, and Virachan being one of the best line of treatment.
Involved in those protocols.
Fantastic.
Can I just ask one more question?
Yes, ma'am.
Because
Please.
Somewhere I could see like you have mentioned Avla, Guduchi, Haridra, Guduchi, and these medicines you have mentioned somewhere.
Yeah.
I think in your PPT you were having these medicines somewhere, that you have given these medicines.
Yeah, ma'am.
So, I mean, what medicines you are telling now, are they different from the medicines which you have mentioned in the PPT, or they were given at different stages?
No, other medicines are used in that case.
Okay. And Dr. Omkar, this is just a suggestion. Like
yes,
now when we use Guduchi as a drug and for liver, we have to be very, very, very careful, because recently I was asked a question that there is so much controversy about Guduchi which is going on. So in view of that, please explain your results. So that becomes then difficult. So just take care about Guduchi and whenever you use its standardization and other things should be in place.
Sure, ma'am. Definitely. Point to be taken. Yep. Yes, Dr. Jinal.
Yes, I would now like to invite our next presenter, Dr. Rakesh Kokde, sir, for presenting his work. Dr. Rakesh, the mic is all yours.
Yes, thank you. Am I audible to everyone?
Yes, you're audible.
Yes, thank you. Hello, ma'am. Will you please share my screen? Yeah, thank you. Could you please share in on show mode, right? Yes. Hello, everyone. This is Dr. Rakesh Kokde from Nagpur Marginagar Clinic. I'm clinic head. My today's topic is management of heart failure. Oh, 1 second, please. My management of heart failure with low EF, low BMI diabetic patient through Ayurveda medicines, Panchkarma, diet, and compliance. Next, please. So we'll discuss about the case, treatment, what was my diagnosis, and then discussion. Next, please. So here we all know the congestive heart failure is a condition, a long-term condition in which heart can pump blood flow enough to meet body needs. Because it can handle the amount of blood it should. So blood builds up in other parts of body. Most of the time it collects in lungs, legs and feet. A low ejection fraction or low EF is a typical 45 or less than. Less than can be evidence of heart failure or cardiomyopathy. A heart ejection fraction refers to the amount or a percentage of blood pump out of the heart left ventricle with each contraction. And about the diabetes, I can share that diabetes is chronic metabolic disease characterized by elevated levels of blood glucose, which leads over time to serious damage to the heart, blood vessels, eyes, kidneys, and nerves. Next, please. So today, my objective is management of congestive heart failure with low EF, low BMI diabetes patient with double vessel disease through Ayurveda medicines, Panchkarma, diet, and compliance. So patient medical history was, she was 40 years female from Nagpur and approached for double vessel disease with heart failure with low EF, that is 30%. She was suffering from diabetes with hypertension since 7 years and taking 2 oral hypoglycemic medicines and 32 units of insulin for diabetes and 1 antihypertensive medicine for blood pressure since 7 years. So patient had cardiac issues in June 2022 and diagnosed for CAD with double vessel disease with 90% stenosis in LAD and 90% in RC and suggested for revascularization therapies. She had been given warfarin, ivabradine, torsemide, ecosprin to manage medical emergencies and suggested for emergency surgery. Patient medical history continues. She had complaints of recurrent UTI, nausea, vomiting, weakness, for which she regularly get admitted in the hospital and unable to take oral food. So after 1 week of post-admissions and discharge, she approached Madhobag, Marginagar Clinic and suggested for blockage management therapy, that is BMP management with heart failure and diabetes reversal therapies as per diagnosis in July 2022. So here are patient details and case descriptions. Is as I already explained, 44 years of female. She has a known case of coronary artery disease with CHF with low EF, low BMI, diabetes, and also anemia. Her HbA1c was 11.4, hemoglobin was 8, and her complaints was chest pain, chest heaviness, breathlessness, weakness, nausea, vomiting, giddiness, anorexia, and lack of sleep. So advised treatment, she was advised for emergency revascularization with medical management. Her investigation done was where ECG, 2D echo, coronary angiography, LFT, KFT, hemoglobin, HbA1c, thyroid profile. And I have suggested for NT-proBNP, fasting and post-meal blood sugar. Next, please. So here was my diagnosis. CAD with CHF with low EF, low BMI, diabetes. Next, please. In treatment point of view, we have started some oral medicines which contains Arjun, Vacha, Bibita, Punarnava, Gokshur, Haridra, Amalki, Daru Haridra, Meshashringi, Kuduchi, Ashwagandha, erand oil, and Shunti. Should I explain all details about Arjuna, Vacha, or Gokshur? Okay, so Arjuna, it has various medical properties like antioxidant, anti-inflammatory, antimicrobial.
The last
Arjuna
1 minute.
Next, please. Next, please. Next, please. Next, please. Next, please. Next, please. Yeah. Apart from oral medicine, we have suggested as patient was low BMI. She has suggested for 1200 kilocalorie diet rich in proteins, vitamins, minerals, fibers. Next, please. In treatment, further Panchkarma was suggested like in centripetal oleation, that is Snehan Karma, Swedan Karma for thermal vasodilation, and PRDA per rectal drug administration for Basti. So for Basti, we have to use Arjun oil and neem oil. For Snehan Karma and Basti, we have used Arjun and Purandava extract, that is 80 ml ARG extracts, and Gudmar, Daru Edra, and Yestumedu 100 ml was for Basti. Next, please. Next, please. Yeah. Here's the treatment. Treatment for blockages with heart failure and diabetes reversal therapy was suggested in started in
kindly
July
come to the
2022.
conclusion.
Yes. Before treatment, you can see the results. Patient was suffering from CAD, DM, CHF, low EF, and anemia. Patient is not taking any medicine for diabetes now, and her ejection fraction was 30% in June 2022, and in her latest ejection fraction is 60%. She was suggested for revascularization therapy, which she was avoided. Her BMI was 16.4 and it is 18.1 right now. and her HbA1c was 11.4, which is 6.9 now, and hemoglobin was 8%, 8 grams, which is 12.6 grams now. Here you can see the reports of the patients, his angiography report. You can see the stenosis part. And further, you can see her echo reports. Previously, her echo was 25 to 30% ejection fraction, and recent echo is 60% ejection fraction. Next, please. So yes, the conclusion is management of heart failure with low EF, low EMI diabetic patient through Ayurveda medicine and Panchkarma diet and compliance can be achieved. Yesterday, I have visited with that patient, and patient is satisfied with the treatment, and the cardiologist who was taking care of her heart disease is also satisfied with her results, and started and suggested to continue the treatment from Madhavbag. So patient is taking only one medicine, that is ecosprin and rosuvastatin. So patient is free from all medicines, and patient is free from cardiovascular disease and diabetes also. So yesterday only she has visited with her husband. That's all from my side.
Thank you, sir. Dr. Supriya ma'am, if you have questions for the presenter.
Only one question, like low
Yes,
BMI. On one side, the patient is having low BMI, so upper tarpan is there, and on the other side there is a double vessel disease, so santarpan janya samprapti is also seen. So
Right.
can you just briefly explain the reason or how this both the things can be
patient
seen?
Actually, she's already a low BMI patient. Her starting weight was 44. But when she induced such diseases, her weight decreases till 39. But depends, as per guidance from our dietitian and our compliance team, she has been suggested 1200 kilocalorie diet, and already actually we have some protein powders. I have suggested to take it daily. So right now we are focusing on her weight. That's it. Overall, she's improved in every parameters.
Okay, thank you.
Yes.
Dr. Omkar, sir, any questions for Dr. Rakesh?
Yes, one point which I have noted, hemoglobin earlier was 8, which was improved to 12.6. And
Yes,
the earlier HbA1c was 11.4, which is now improved to 6.9. So
yes.
was there any, chances that the patient had low HB, hence HbA1c was raised?
No, sir.
Reason?
Actually, yes. No. There was.
Oh, sorry. Just a moment. Just a moment, doctor. Yeah, please.
That was not the condition actually. Her hemoglobin was related with her diet and stress level, and she has she has only stressful job previously she was doing. So she is free. She has suggested to quit her job, as there is no reason between
majority of cases
and
wherein the patient is anemic, then we get some false raised HbA1c too. Right. So in this case, if the treatment has also included medications wherein the anemia of the patient is been brought back to the normal range, obviously then you will see drop down in HbA1c too.
Right.
But overall, the results in this case are fantastic. From EF 30-35, you've got a result of 60%. HbA1c from 11.4, it's come down to 6.9. So that is a fantastic result. Right? Excellent presentation, Doctor. Superb.
Thank you so much. Thank you.
Yes, Dr. Jinal.
Yes, we would now move ahead with the next presenter for the evening, Dr. Shraddha Chaube. I invite you to the stage.
Good evening, everyone. Myself, Dr. Shraddha Chaube, Clinic Head, Ayurveda Colony, Bhopal. Pallavi ma'am, kindly share my PPT. My topic is role of Anuvasan Vasti in low BMI patient having problems of ischemia, heart failure, diabetes, and hypertension. Next. The objective of the research paper is to investigate the potential effectiveness of Anuvasan Vasti in addressing the health issues of low BMI patients with comorbidities such as ischemia, heart failure, diabetes, and hypertension. Vasti is one of the main therapy used in Ayurvedic Panchkarma therapies. It is a therapeutic enema that involves the administration of herbal decoctions, oils, or ghee and other preparations into the rectum. An oil-based Vasti called Anuvasan Vasti It is used to nourish and lubricate the tissues, balance the doshas and the fundamental energies of the body, and remove the toxins from the body. Next. A 66-year-old male patient came to our clinic with history of diabetes since 20 years, BP since 3 years, with triple vessel disease, PTCA done on 7th May 2021. When patient came to clinic, he came to clinic on wheelchair as he is suffering from DOE grade 4, along with severe weakness, giddiness, pitting pedal edema, generalized swelling, and chest pain with fluctuations in his heart rate and oxygen saturation. His anti-pro-BNP was about 16,000 and came to us as he was advised for CABG and he doesn't want to go for another surgery. Patient is was on medication before treatment: dapagliflozin, pantoprazole, doxycycline, aspirin, clopidogrel, atorvastatin, carvedilol, glimepiride, Ditor, insulin 6 units thrice a day. After 3 months, he is on Ecosprin 75, Ditor, dapagliflozin, clopidogrel, atorvastatin. He is on Ayurvedic medicine: Madhaprash, Arjun, Gokshur, Hydra, Amalki, and Pundarnava. It is his 2D echo reports. Result shows no deterioration seen in echo reports. Patient CHF status is stable now. Next. Treatment, we given Snehan with 100 ml of til oil and lavender oil, Sweden with Dashmul Kadha, Basti, administration of 240 ml oil, which is prepared with Gokshur, Hydra, and Amalki. And second preparation was administration of 240 ml oil prepared with ashwagandha, ela, bala, and atibala. Patient was suggested for diet, which is given was 1000 kilocalorie diet having high ORAC value, rich in vitamin, rich in antioxidants, low calorie diet, low carb diet, low fat, and rich in fiber diet. Restricted water to 1.5 liters per day. Exercise which was suggested, patient was advised for 2 minutes walk after taking some rest and continue his walk in interval of 15 minutes, Anulom Vilom Pranayam, meditation, stretching exercises, given exercise kit which includes pyrometer, TheraBand, and balloon, with regular monitoring of patient's vitals and diet on MIB Pulse app. Next. Results with parameters before and after 3 months: weight 50.7 to 54.3, BMI 21.5 to 23, HbA1c 7.9 to 6.3. On ABPM, he was on stage 1 hypertension. Recently, no evidences. VO2 max 5.78 to 19.58. Mid value 1.7 to 5.6. Anti-pro-BNP 16,000 to 1038. Patient and his family members are very happy now. Now he comes to clinic without any support of his family members, can do his own work independently. Now he can walk for more than 15 minutes without taking any gap. No edema, no weakness, and is stable now. Next discussion. The prevalence of low BMI, ischemia, heart failure, diabetes, and hypertension has been increasing in recent years. Current treatments for this condition often involve medications and lifestyle changes. The effect of using Gokshur, Haridra, Amal,
last 1 minute.
Okay. Ashwagandha, when combined in an Anuvashan Vasti using til as a base, they can have a number of therapeutic effects on our body, helps to support oral health and prevents relaxation and balance the doshas in the body. Apart from having anti-inflammatory, antioxidant, and analgesic properties, having the hypoglycemic and hypolipidemic effects, which can help to reduce the risk of diabetes and hypertension. Additionally, the Gokshur contains compounds like flavonoids, saponins, and alkaloids, which stimulates insulin secretions from the pancreas. They also act as diuretics, which has to remove excess fluids from the body and reduce the blood pressure. Hydra contains curcumin, which has to reduce inflammation in the body. Amalki is rich in vitamin C, which has to boost the immune system and protect against the oxidative stress. Bala is a rich source of alkaloids and flavonoids, which has to improve muscle strength and tone, which can be beneficial for low BMI patients. Ashwagandha is an adaptogenic herb that helps to reduce stress and anxiety. Next.
Ma'am, I'd like you to conclude.
Conclusion. Anuvashan Vasti treatment can be considered as an alternative or complementary treatment along with standard medical treatment in low BMI patients with a ever mentioned health complications. Thank you.
Wonderful. Dr. Supriya ma'am, if you have questions for the presenter.
Yeah. Can you just explain rationale of these drugs from Ayurvedic viewpoint? Because we are talking in Ayurveda Cardiology Symposium. So we should give some Ayurveda rationale why you have used these drugs. And even if it is your standard protocol of Madhavag, you should explain the rationale from Ayurveda viewpoint as well.
Ma'am, I have mentioned about something, some drugs, Gokshur, Bala, Atibala, and
So
Ashwagandha.
why these drugs and how they will be helping the patient from Ayurveda viewpoint? Because you said like steroidogenic and what all you have mentioned, the big terms. I do not understand those terms. So I'm a Ayurveda scholar. So I just want to know like what is use of these drugs from Ayurveda viewpoint.
Okay, in the sense of good Rasvirya and Vipak.
Yeah, Rasavirya Vipak also. And since you are talking about low BMI patients, so Santarpan is a main cardio which you should do. So how these drugs are helping in that you should explain somewhere.
Okay,
You should talk about those things. It is good that you are taking efforts to read their pharmacological activities and the reported activities, but first thing is we should explain them from Ayurveda viewpoint. First
Agreed.
thought which come in our mind is from Ayurveda, how they will be, Ayurveda pharmacology philosophy point, how they will be helpful. And then comes like supporting evidence. Yeah. Okay, thank you.
Okay, Pallavi ma'am, if you can just share that slide wherein the pre and post results are highlighted. Pallavi ma'am, if you can just share Dr. Shraddha's slide wherein that anti-pro-BNP pre and post treatment. I just wanted to comment on that. I think it was some second last or third last slide wherein the pre and post results have been shared. Something really nice in this case. Yes, perfect. Kindly you just click on the slideshow. Now, Dr. Shraddha, you have a fantastic result over here. But if you don't highlight the same in front of all, it will get mixed up with all the other parameters. Now, the anti-pro-BNP of this patient was 16,009, wherein after 3 months of treatment, that is reduced down to 1038. That itself is a fantastic achievement. And what Dr. Supriya Madam is trying to explain is, if you have used Gokshur in your methodology, Gokshur is a Mutral agent, right? The Gunadharma of Gokshur is Mutral, and anti-pro-BNP, the whole logic is how your cardiac muscles are dilating due to fluid volume, overload of fluid, right? Now, obviously, if the cardiac muscles are dilated due to excess of fluid and you are using Gokshur with the logic of Mutral Dravya, definitely the anti-pro-BNP is going to reduce down. You get my point?
Yes, sir.
And this is also in turn going to help the cardiac muscles for a proper contractility. If the cardiac muscles are quite dilated, obviously the contractility will be affected. And this you can see in the MET value and VO2 max, the changes from the MET value from 1.7 to 5.6 and VO2 max from 5.7 to 19.58. So these kind of things you need to explain from an Ayurveda perspective to whatever medications you are using, so that it will be well understood by all the presenters. Obviously, in Madhavbag, we are using all the modern diagnostic tools, but the complete treatment principles are based on Ayurveda. So it may be Agni, it may be Srotas, it may be all the other dhatus, upadhatus, each and every aspect wherein you are using the methodology from Ayurveda perspective has to be highlighted. Obviously, the reports are there for pre and post, which are going to give a concrete evidence that obviously all the medicines which you have used, may it be through your medications, oral medications, Panchkarma, diet, exercise, they are going to give good results through these reports. The next time when you present, you should highlight out of these what was the basic parameter which you which has given fantastic results in this patient, right? Rest overall the presentation was superb. Nothing to ask further.
And Dr. Omkar, I have also missed that thing. What you highlighted. So she should highlight these things and make a habit of putting units also in front of every parameter, because you have simply written weight, so kg per meter square. So try to add units also.
Yes, sir.
Overall, fantastic presentation, Dr. Shraddha.
Yes.
Thank you.
Yes.
Congratulations.
Thank
Yes,
you.
Dr. Jinal.
Yes, moving on to our next presenter, Dr. Surbhi Sharma. Dr. Surbhi, I would like you to take the stage.
Okay, thank you, ma'am. Good evening, seniors. Pallavi ma'am, please share, ma'am. Thank you. What is the long-term impact of ischemia reversal program based treatment on the quality of life of patient who has undergone the CABG, POBA, and PTCA process? We use the IRP for a reduction of occultation and plaque stabilization endothelium dysfunction. Presenter introduction. Myself, Dr. Surbhi Sharma, compliance doctor, Kolar Clinic, Bhopal, working with a mother bug and practicing as a preventive cardiologist from last 3 years. Next slide. Primary research question is, what is the long-term impact of IRP-based treatment on the quality of life of patients who have undergone the CABG, POBA, PTCA process? Secondary research question is, can IRP be considered as a first line of treatment of occultation? Next slide. My case detail is patient background, a male patient, 55 years of age, with a medical history spanning 26 years of diabetes, 20 years of hypertension, and previous CABG, PTCA, POBA process in 2005, 2012, 2019 respectively. The patient presented with a symptom including severe chest heaviness, chest pain, discomfort, fatigue, weakness, shortness of breath, pedal edema, weakness, sleep disturbance, anxiety, dizziness, and constipation. Diagnosis is following a comprehensive medical examination and testing. The patient was diagnosed with a triple vessel disease in conjunction with a diabetes and hypertension. Next slide. Treatment. The patient underwent the Panchkarma ischemia reversal program, a combination of Snehan with 100 ml of sesame oil and lavender oil, Svedana Dashmula, Vasti with a lukewarm GHA decoction 100 ml, जिसमें गोक्षुर हरिद्र की और अमल की रहता है, to decrease the ischemic heart disease symptoms. The patient was prescribed medication including Gokshur, Amalki, Vincol Churn, NKG Churn, Amari oil, Haridra granules, Haridra, Amalki, Daru Haridra, Banava, and Madhavprash Rasayan. Gokshur mainly diuretic है, hypolipidemic है, cardioprotector है, जो कि mainly increasing and extensing nitric oxide secretion in coronary blood vessels. The patient was advised to follow a diet rich in fruits and vegetables with high ORAC value, high fiber, and high omega fatty acid. Outcome of this, before the treatment, HSCRP of patient is 3.3. After the treatment is HSCRP is 1.3 and NLR ratio is 5, and after the treatment is 2.12. HbA1c before the treatment is 10.1 and with the insulin of 80 units. After the treatment is HbA1c is 5.6 and before the treatment HbA is 12.5. After the treatment is 13.9. Total cholesterol is 112 and after the treatment is 125. SDL is 40 and after the treatment is increases in 53.40. VLDL is 21 and after the treatment is VLDL is 29.36. Triglycerides is 115 and after the treatment is 125. VO2 max patient is on walk test 5.38 and after the treatment is VO2 max is 24.98. Next slide. Other case details is day 1 medication patient is on 16 medicines: isosorbate trinitrate, glycerate trinitrate, aspirin, losartan 50 mg, acarbose 50 mg, amlodipine, rosuvastatin, glimepiride, XR90, insulin 80 units BD. 40 units BD. Current medication is glimepiride and metformin BD. Post-treatment is improved in quality of life, reduction in chest pain, improved mental health. Next slide. Follow-up of last 2 years. I'm advising patient 4 days of moon diet every month, intermittent fasting on fortnight. Herbal medicine is Madhavprash, Vincol, and NKG Churn is continued, and advising him a spirometer, daily exercise of and 20 minutes of daily morning exercise, strength training exercise. Monthly once a Snehan Svedana Vasti advise him. Conclusion of this, Our study has demonstrated a significant positive effect of IRP-based treatment on long-term quality of life of patient who has undergone the CABG, POB, PTCA process. Our finding reveals that IRP-based intervention has shown improvement in multiple domains, including physical functioning, emotional well-being, and pain management and overall satisfaction. Recommendation is overall, this study fills an important gap in the literature, providing evidence for the effectiveness of IRP-based treatment in improving the quality of life of patient who has undergone the COBG, POBA, PTCA. The integration of IRP-based approaches into the clinical practice has the potential to significantly enhance of long-term well-being these patients and improve their overall outcome. Final is this, my patient views after this कि
Ma'am, I'd like you to
आपने मुझे
conclude.
देना है. Thank you, मैम ने. Thank you.
Dr. Supriya, if you have questions for the presenter.
Yeah, just a simple question. What do you mean by ORAC?
सर मैम ऑक्सीजन रेडिकल कैपेसिटी होती है जो हम लोगों के ऑक्सीजन जो ब्लड के साथ मर्ज होता है उसी के लिए रेडिकल कैपेसिटी बताई जाती है.
तो सब फूड्स के लिए ओरैक कैपेसिटी अवेलेबल रहती है, मीन्स जो कुछ हम खाते हैं जैसे कैरेट है, बीटरूट है, सबके लिए ओरैक कैपेसिटी नोन होती है?
यस मैम, ऑक्सीजन रेडिकल एब्जॉर्प्शन कैपेसिटी रहती है और हम लोग जो माधव प्राश दे रहे हैं और डाइट बॉक्स है उसमें हम लोगों के यहाँ हायर ओरैक वैल्यू है.
Yes, but I'm just asking, like, whether do you know any substance ORAC capacity other than the diet which you have given?
सर मैम आंवला है.
So how much ORAC value it has?
Mainly is 60,000.
Okay, fine. So when you are talking about something, no, then you should know the things around that also. Okay.
Yes, ma'am. Beans and nasa. Thank you, ma'am.
Thank you.
Very rightly pointed, ma'am. Dr. Onkar, sir, any questions for Dr.
Yes,
Surbi?
Dr. Surbi, fantastic presentation. The only thing which I need to highlight over here, your slides were superb, but the best part of the slide was so small that we hardly could see the number figures. See, in a research presentation, the pre and post parametric improvement needs to be highlighted. Now, your case was a triple vessel disease case along with HTN and diabetes, right? So parameters like HSCRP. HSCRP is high sensitivity C-reactive protein, right? Obviously, when we are treating a patient of atherosclerosis, then the inflammation of the blood vessels need to be seen pre and post treatment, and HSCRP is the test wherein we can actually mark the inflammation pre and post, right? We are using dravyas like amalaki, which is a fantastic antioxidant medicine. We are using haridra, which is an anti-inflammatory medicine, right? Now these dhatari nisha, which we are using in all our diabetic patients, we need to make sure that the results of this is being checked through some kind of a parameter. And HSCRP will definitely show you about the parametric improvement as per the inflammation of the blood vessels, right? Yes, and that was so small that I could barely see the number figures, but still I could manage to note down that it was 3.3 earlier and then it was 1.3. And the other ratio, which Rahul sir has specifically mentioned in all the sessions which he has taken about, atherosclerosis, that is NLR ratio.
Yes, sir.
Right? NLR ratio from 5, it has come to 2.12. So definitely inflammation in the body has been reduced by your treatment. This is something which you need to highlight. ORAC is oxygen radical absorbance capacity. Now in the diet box which we are using, it's more than 65,000. So the dravyas which we have used in it, in total, they are giving an ORAC of 65,000. Right? This is the thing which you need to highlight. Similarly, when we talk about diabetic things, high glycemic index, low glycemic index, such kind of things should be known for all the grains or fruits or vegetables, whatever we are using in our treatment. So the point which Supriya madam was trying to highlight, that apart from our routine treatments, we should also know about all these stuffs. so that in whenever we are going to present in front of the scientific community, then definitely we'll have a good confidence and we can have a good Siddhantic Sambhashan over there. Perfect?
Yes, sir.
Right? In this
Yes,
case,
sir.
your VO2 max of the patient has rise from 5.18 to 24.98. So just imagine the mortality ratio earlier, less than 15 is highest risk of mortality. Your patient was in a scale of 5.18 VO2 max. And after your treatment, the VO2 max has rise to 24.98, near about 25. So the chances of mortality of the patients have reduced drastically. That should be the core of your treatment. This is your achievement. So fantastic
Yes,
results, but you need to understand that you need to highlight these things, right? Out of the 10, 12 slides, whichever you're going to present, this was the best aspect and it was so small. Okay. So the next time you present, you need to make sure your achievements have to be highlighted, right? Best wishes. Thank you.
Thank
Yes, Jinal ma'am.
I would now like to call upon Dr. Preeti Goswami. Before I hand over the stage to her, we have finished half of the presenters for today's evening. And I would like to remind the chairpersons to share the Excel sheet provided to you at the end of the session so that we can declare a best paper. Thank you. Dr. Preeti, the stage is all yours.
Thank you, ma'am. Am I audible?
Yes.
Yes, ma'am. Continue.
Okay, thank you. Thank you, Pallavi, ma'am. Kindly share. Okay, thank you. Good evening, everyone. Myself, Dr. Preeti Bhalerao Goswami, and I am representing here a single case study in which my research question, case detail, diagnosis, and a discussion and takeaway message I share with you. My objective is to give a healthy life to a person who is obese and suffering from diabetes type 2 with HTN and CAD, triple vessel disease, and his CABG already done. Next slide, ma'am, please. Here is a case of 69-year male patient who is suffering from dyspnea, burning sole, calf pain or exertion, gases, distension, heaviness in chest, and constipation. So I advised him HbA1c, stress test, and ABPM. Next slide, ma'am. So when patient came to our clinic, he is already diagnosed by diabetes, CAD, CABG already done, HTN, hyperlipidemic. But when we treat him, then we got our results. Patient was GTT negative, and we reversed his heart disease. Next slide, please. When we investigate, his HbA1c was 7.3. BMI was 26, and with allopathy medicine, his BP was 115/67, and the RB is high, most probably 180 plus. उनकी जो है वो random blood sugar जाती थी. But when we conduct stress test, his BP was 170/102 on modified Bruce protocol stress test. Next slide, please. His TMT was negative. He's taking already glimepiride and metformin combination on BD. Atorvastatin and aspirin HS, hydrochlorothiazide and metoprolol on OD dose. Next slide, please. So when we start his treatment for tapering his medicines and to reverse his disease, diabetes and heart disease and hypertension and his weight loss, we start using Meshangi, Guduchi, Daru Haridra, Amlaki, Haridra, Shunti, and Vacha. Next slide, please. These are the main medicines for my treatment, and supportive medicines are Apamar, Parijat, Kutki, Bhunimb, Rohtaki, Pipli, Arjun, and Vivitak. Next slide, please. With oral medicines, we started diet of 800 kilocalorie diet per day, which is low carb diet, moderate fat and protein. And after 2 months of his weight loss, we started oats, barley, sprout, wheat bran, cinnamon, fruits, salad, smoothie, and soup to maintain his weight. We started Panchkarma, in which we include centripetal oleation to reduce intramyocellular fat deposition and insulin resistance, thermal vasodilation to improve endothelial dysfunction, per rectal drug administration, Basti, to promote regeneration of islet cells, Hridayadhara, thoracic drip to improve heart capacity, and Shirodhara to regulate blood pressure. Next slide. total we provide 18 Panchkarma for diabetes, in which we use neem tel and til tel for Snehan. For Svedan, we use Dashmul Kada and PRDA by Gurmar, Daru Hydra and Yashtimadu combination. For heart, we provide 7 Panchkarma, in which Snehan by Arjun Tel, Svedan by Dashmul Kada, PRDA by Arjun Kada and Hriday Dhara by Dashmul Kada. For hypertension reversal, we provide 5 Panchkarma, in which Snehan done by Rose and Til Tel, Svedan by Dashmul Kada and Hriday Dhara by Shirodhara by Jatamasi Kada. Next slide, please. Overall, we achieve our goal by Panchkarma therapies, diet, Ayurvedic medicines, exercise, meditation and investigation. And we finally reverse his diabetes type 2 reversal, GTT report negative है patient की, HTN reversal, एम्बुलेटरी ब्लड प्रेशर मॉनिटरिंग की रिपोर्ट हमारे पास नॉर्मल है। वेट मैनेजमेंट जो हमने किया है, आज तक पेशेंट जो है वो 23 BMI पर ही स्टक है, उनका कंटिन्यू वेट लॉस नहीं हो रहा है। हार्ट डिसीज रिवर्सल किया हमने स्ट्रेस टेस्ट पर, जो कि नेगेटिव था, बट हमने जो पेशेंट की तकलीफें थी उसको दूर करके दिया है। हार्ट कैपेसिटी हमने इंप्रूव की है बाय VO2 मैट। नेक्स्ट स्लाइड प्लीज। ओवरऑल अगर हम देखें तो हमारा जो HbA1c था पेशेंट का वो 7.3 से 5.3 आया और सारी रिपोर्ट्स हमारी नॉर्मल थी। नेक्स्ट स्लाइड प्लीज। ओवरऑल अगर हम देखें तो डायबिटीज टाइप 2 मेनली कॉज्ड बाय बैड लाइफस्टाइल व्हिच इज रिस्पांसिबल फॉर वेट गेन, इंक्रीज्ड BMI, हाई ब्लड प्रेशर एंड CAD। Thus we treat mainly 3 causes: intracellular fat accumulation, insulin resistance and blood vessel damage. Because Panchkarma therapy helps to maintain vascular health and proper insulin secretion, diet to balance negative calorie balance, exercise for muscle health and increase vascular capacity, meditation for mental health and medicine for healthy system function. Next slide. ओवरऑल हमारा कंक्लूजन यही है कि यदि हमने किसी भी ऐसे व्यक्ति का डायबिटीज रिवर्स कर दिया तो उनका आगे जाके हाइपरटेंशन भी रिवर्स हो सकता है, उनका वेट लॉस होगा और डेफिनेटली वो एक हेल्दी हार्ट पाएंगे। क्योंकि ये पेशेंट जिस दिन हमने इनका GTT नेगेटिव किया और उनको फेलिसिटेट किया, उस दिन पेशेंट आके मुझसे बोले मैडम अभी मेरा हार्ट भी सही करके दीजिए। और डेफिनेटली मैं एक ही चीज बोलूंगी कि ठान लिया तो मंजिल पाना तय है। और इसीलिए मैं टेक अवे मैसेज देना चाहूंगी कि आप जो है, मैम स्लाइड चेंज प्लीज, कि आप फॉलो लाइफ स्टाइल, लो कार्ब डाइट, एक्सरसाइज कीजिए, मेडिटेशन कीजिए और इन्वेस्टिगेशन करने के बाद में डॉक्टर से उसे अपने पेशेंट को शेयर करना ही चाहिए। और आज भी पेशेंट 2 साल हो गए बट मुझसे कनेक्टेड है, इन्वेस्टिगेशन शेयर करते रहते हैं और वो हैप्पी हैं। थैंक यू एवरीवन।
Wonderful. Dr. Supriya, if you have questions for Dr. Preeti.
Yeah, Dr. Preeti, you have mentioned in one of your slides that whether the disease reversal is possible. So do you really think that diabetes is reversible or it is just manageable? It can be kept under control or it can be reversed in diabetic patients as well?
Ma'am, actually diabetes is reversible disease. My last year presentation was I performed GTT since 3 years of a patient who is actually 23-year-old when he suffered from diabetic. There is no family history of diabetes or any other disease. But I performed GTT last since 3 years and he is GTT negative. और मैं एक चीज प्रेजेंट आपको शेयर करना चाहूंगी कि वो जो है पेशेंट जिन्होंने GTT करवाया, जलेबी 250 ग्राम जलेबी खा के अगले दिन उन्होंने अपना GTT परफॉर्म किया, उनकी पोस्ट मील रीडिंग 127 थी। सेम चीज यही पेशेंट के साथ भी थी कि चाहे वो 70 ईयर के हो गए, 72 प्लस हो गए, बट आज भी वो अपनी डाइट फॉलो कर रहे हैं और आज भी उनकी सारी रीडिंग्स नॉर्मल है। और मेरे जितने भी मैंने पेशेंट्स ट्रीट किए हैं उनका HbA1c चाहे 5 साल हो जाए लेकिन कभी भी मोर देन 7 नहीं गया है। तो आई एम कॉन्फिडेंट कि डायबिटीज रिवर्सिबल डिसीज है, हार्ट डिसीज भी रिवर्सिबल है और वो मेंटेन ही नहीं हमेशा रिवर्सिबल होता है।
I am just giving a thought for your consideration. We will not discuss it because it is already too late. But lifestyle is also a management strategy for diabetes. So it is controlled or it is reversed. What you are saying, it is managed with lifestyle. That is the right word.
Yes, but if we done proper investigation.
See, just a second. Just listen to me. That if the person lives that lifestyle, it will be reversed. It is like we say that it is managed with, it is managed with tablets, it is managed with insulin, it is managed with lifestyle. So it is managed with lifestyle, it is kept under control with lifestyle. If you leave that lifestyle, tomorrow it will be reversed. So it is reversible is a very very specific word and you should use it with caution. So I'm just leaving you with a thought. We will not discuss further. We will discuss on some other forum.
Yes, ma'am, definitely.
You got my point.
Yes, ma'am, I agree.
Yeah.
Thank you, ma'am.
Dr. Omkar, sir, do you have any
Yes,
questions
Dr.
for Dr.
Congratulations on the fantastic results in this case, as the patient is
Thank you,
GPT
sir.
negative, and as well as the ABPM report, which you may have done at the post-treatment, that is normal. So overall, fantastic results. No questions from mine. Super.
Thank you, sir. Thank you.
Yes, Dr. Jinal, we'll move on.
Now
to the
I
next
would
presenter.
like to call upon the next presenter, Dr. Arunima Yadav. Dr. Arunima, the stage is all yours.
Good evening, dignitaries and my dear colleagues. Today my topic of presentation is role of Ayurvedic treatment, that is Deepan Pachan, Amdosh Nirharan, Santarpan Chikitsa in mixed connective tissue disease with special reference to Ambat. I want to bring your focus that generally people take Ambat as a generally people coordinate Ambat with rheumatoid arthritis, but this time I have made it similar with mixed connective tissue disease. So my aim of the study is mixed connective tissue disease is very painful and devastating disease. My screen is visible or not?
Yes, ma'am.
Mixed connective tissue disease is very painful and devastating disease which doesn't have any cure. Preventing medicine have lots of side effects, especially other medicine than Ayurveda. Prognosis is very poor in terms of both quality and quantity of patient's life. So my study is about approaching Ayurvedic way to improve quality and quantity of patient's life without any side effect. And there is very important role of interprofessional team in terms of setting goal on diet, meditation, exercise, etc. So my objective is to identify the etiological, typical presentation and treatment option of mixed connective tissue disease with a special reference to Ambat. Mixed connective tissue disease is a combination of 5 diseases that may be polymyositis, dermatomyositis, RA, systemic sclerosis, and lupus. There is compulsion that 2 diseases should be present over there. Etiology is autoimmune activation. As we know, Viruddhahar Cheshta can create Ambat. Symptoms are very much similar to Ambat Lakshan, that is Aruchi, Prashek, Agnimand, Sandhi Roja, Sandhi Shodh, Sandhi Stabdata, Jwar, Gaurav, Dahashul, Utsahani, Brahmurcha, Nidra Viparya. These are the few pictures which patient look like. Not my patient. My patient was not happy to share her image. So this is the just, I want to give you the idea how these patients looks like. So these are the images of different things, just like this is the image of myositis. Prevalence is, it is very common, not very common disease. Only 6.4% get out of 1 lakh affected by it, and higher in women. Age wise, in early age people get affected of this. Symptom wise, yes, their RA is very common on these people. Angamard and Gauravta is very common. If we talk about pathophysiology, then hyperactivity of B lymphocytes creates high level of anti-U1 RNP.
Ma'am, your PPT is not moving ahead. It is still on the symptom slide.
Okay. Now is it visible?
Yes,
Yes,
Pallavi, I
ma'am.
think you can. Yes.
I think if Pallavi ma'am can share.
And pathogenesis is visible?
No, right now we can see the butterfly rash.
Yeah.
Okay, Pallavi ma'am, please.
I think the Pallavi was sharing the slides.
No, I was sharing the slide.
Dr. Arunima, if you want to share the slide, then Pallavi, please stop sharing.
No, ma'am was sharing actually. Now Pallavi madam is sharing.
Pallavi ma'am, you share the slide. As I have lots of slides and I want to move it very fast. Pallavi ma'am, please, quick. So our slide pathogenesis. Next slide, please. Next. keep on moving, keep on moving, keep on moving, keep on moving. Pathogenesis. As Prakopit Vat and Amdosh creates Sambat, which moves to Dhamni, reaches to Shrotas, creates clay, and it wherever it goes, at that sthan that creates symptoms. So next slide please. My patient detail is she was 2-year-old female with 40 kg, 150 centimeter of height, 40 kg of weight, abdominal girth was 72. Her BP was normal. I want to bring your focus that she was taking medicine in that steroid level was at peak. She was taking Medrol 16 mg per day. Next slide, please. And other medicine are also visible on your slide. My patient got mixed connective tissue disease on the year 2009, and she had presented this with anemia, anti-U1 RNP positive, inflammatory polyarthritis, Raynaud's phenomena, and PSS. Next slide, please.
Last 1 minute.
Her present complaint was general feeling of being unwell, fatigue, mild fever, cold and numb fingers, swollen fingers, muscle and joint pain, rashes and continuous pervaginal bleeding. Next slide, please. These are the investigation done. Next slide, please. I have followed the Amba Chikitsa Siddhant, that is Langan Svedan, use of drug of Tikta Katuras, Deepan, Virechan, Oleation, and Basti. Next slide, please. I want to bring your focus over here. I have given her Sweden 21 therapies for 11 weeks in the interval of 2 to 3 days, that is twice a week, followed by Basti. Ampachan done by some Tikta Katu drug with Chitrakadivati with Manjishta rest. Next slide is
Sweden done to conclude.
Yes, Sweden done by Shankar Swed, which was heated over the Kanji steam, followed by Sendavadi Tel Basti 60 ml. Next slide, please. She was given these medicine in first phase: Gandak Rasayan, Ambatari Ras, Sehnath Gukul, Mahabhat Vidvanshan Ras, Swarna Gukul, Vaishwanar Chun. Next slide, please. Then I reduced her medicine and she was given Virechan once in a week by castor oil, Vaishwanar Chun, Sehnath Gukul, Ambatari Ras. Next slide, please. These are the path which I told her to follow, especially Yav diet I gave her. Next slide. I want to bring your focus here. I made a special preparation for her, that is Sont ki laddu. It was made up of jao ka atta. Castor oil was in it so that absorption is up to the mark, which I wanted. Sunthi powder was there, and rest of the content you can see. It made her feel well, and she is happy to take. It was medicine as well as diet. Next slide, please. So I prescribed her Dhyan, Satsang, stretching and mild exercise. Next slide.
Please conclude.
Satsang was very important. Next slide, please. Because she was mentally deprived. These are the results. Her medicine was tapered tremendously. Medrol was tapered to 2 mg from 16 mg, which is fast. Next slide, please. Her hemoglobin increased. Her ESR decreased. Next slide, please. Ambat has typical lakshana of Bahumutrita. Her protein.
Dr. Arunima, we're not able to hear you.
Yeah, there's some technical lag. Dr. Arunima? Dr. Arunima, can you hear us? Are we audible? I think there is some technical issue with the internet at Dr. Arunima Yadav's place. Yes, she's left. Just a moment.
She has lost. I just need a conclusion only.
Yeah. Pallavi madam, can you just share the conclusion slide?
Result, observation and conclusion. Last two slides. Almost done. It was.
Yes, ma'am. We have the conclusion.
It is not visible to me. I think it is visible. Is it visible to you all?
Yes, it's visible to us, ma'am.
It is not visible to me. I just want to say that these kind of disease require an interprofessional team to work on diet, exercise, mental challenges, and treatment. So I took all the steps, and finally I could reduce her steroid, which is very important to improve her quality and quantity of life, and it helped me a lot. It was an apta chikitsa, I got it from the text and I concluded on the patient. Much research is required to further help those kind of people, because lots of people are suffering from these kind of diseases. Thank you.
Yes, ma'am. Thank you very much. Dr. Supriya, ma'am, any questions for the presenter?
No, not a question. It was a very good presentation, and I am happy that you even used Ayurveda references and you backed up your treatment with Ayurveda references. So congratulations. Just that you could have reduced the slide number, so you could have finished in time.
Yes, ma'am. The internet problem was also there. So, and my motive was to say that Amvat is not only connected with rheumatoid arthritis. Many autoimmune diseases are similar to Amvat. We need to look for these and treat those patients.
Probably Amvat can be considered as a window to look at the autoimmune disease.
Yes.
Great presentation. Congratulations.
Thank you, ma'am.
A wonderful outlook, madam. Dr. Omkar, sir, any questions to Dr. Arunima?
Yes, only one thing. You have mentioned a new concept called as Shunti ke Laddu.
Yes, sir. Yes. Sir.
Right. And in that I could see castor oil as well as Gogruta. Right. So usually in Amavat or Samata, we prefer Eranda. And in Niramata, we prefer Gogruta. In this condition, we have Eranda as well as Gogruta. So what was the methodology or the thought process behind this?
Sir, we can't see my whole presentation. Firstly I did Ampachan, and that if we see her weight was very less. So I wanted to do Santarpan followed by Aptarpan or Ampachan. So that's why I gave her Gograt, so that Laddu may become like Laddu. And castor oil has a specialty. If it is given after meal in large doses, then it creates purgation. If it is given less than 5 ml of amount with the meal, then it get absorbs and it shows its property against the autoimmune disease,
as an
and
anti-inflammatory.
also it becomes palatable. Otherwise means you can't say patient to apply it on chapati and have it.
Yes.
So
Hence
these
in
are the
Amvat
laddu.
Chikitsa, it has been mentioned as Eranda Gaja Kesari.
Yes, sir.
Right. So a lesser dose of Eranda will cause an anti-inflammatory effect, and more dosage of Eranda will cause a purgative.
And the point is that Shunti is also there. And our Madhav Shakti Atta has Yav. In Yav is prescribed as diet. That was also my new finding, but it was up. It was my new finding. So
very nice.
It
very
is
nice.
written over
Fantastic presentation and superb. Overall, if you can collate or compile such cases which come to you, and if you can try those laddus in all these kinds of patients, you will have a good series of cases. And definitely, I think Rahul sir is also here, and we can think about something new, a new intervention, new product for the patients who are suffering from Amavat or Samavat. Okay. Thanks a lot, ma'am. Thank you. Dr. Jeannie, over to you, ma'am.
Quickly moving on to our next presenter, Dr. Swati Kumtekar. Dr. Swati, the stage is all yours.
Thank you, ma'am. Good evening, all. Pallavi, ma'am, please share my PPT. Good evening, all. This is Dr. Swati Kumthekar from Ahmednagar, Maharashtra, Clinic Head, Madhavbag, presenting a case study. Effect of Ayurveda-based treatment to improve LV strength in non-CAD with IHD patient with respect of GLS. Next. Objective to conclude non-invasive Ayurveda-based IRP ischemia reversal program treatment can also help to cure IHD with CAD patient. Next. Here is a patient medical history. Next. A 55 years old male patient having history of type 2 DM and hypertension since 2010 and recently diagnosed with triple vessel disease. He was having chest pain since last 5 months. Therefore, he underwent coronary angiography and advised EABG. Patient was looking for non-invasive cardiac treatment, hence visited my clinic. Initially, his complaints was chest pain on exertion, frequently hyperacidity and gases. Investigation advice, ECG resting was normal, stress test was positive, HbA1c and lipid profile I have mentioned in my next slide. CBC was normal. 2D echo with GLS the GLS score was -15. With this investigation, I diagnosed patient with type 2 DM, hypertension, CAD and IHD. Next. Here is a treatment plan. Ischemia reversal program for 90 days includes reverse diet box, Panchkarma, exercise, medications, and MIB pulse app for tracking. Next, diet. Diet includes reverse diet box, which is high antioxidant, low carbohydrate, high protein, high fiber diet for 3 months. Panchkarma, centripetal oleation with Abhyanga oil. Abhyanga oil contains tilakaila and lavender oil. Thermal vasodilation with Dashamul Kadha, PRDA with Gokshur, Amlaki and Haridra. Stretching exercises, yoga, pranayam and meditation I have advised. And these are some Ayurvedic medications I have used here. And MIB Pulse app for monitoring diet and exercise compliance. Next. These are some parameters with timeline I have observed on day 1, day 30 and day 90. There is a significant improvement in abdomen girth. Initially, it was 104 centimeter and it reduced up to 87 centimeter. HbA1c was 9.4 and now 6.8. Stress test was positive and now negative. Next. These are some allopathy medications. Initially, patient was taking 9 tablets, OHA, anti-anginal, nitrates, antiplatelet, and now it is few, only 3 medications. Next. And here are the results with this treatment. The bullseye image in GLS report itself explaining everything. GLS score was initially -15 and after it improved up to -20. And there is a significant remarkable improvement in stroke volume. Initially it was 22 ml and after 72 ml. Next. So how I got this result? Ischemia reversal treatment, Snehana with Abhyanga oil, improves elasticity of peripheral blood vessel, increases preload and hence increases cardiac output and also reduces inflammation. Swedana with Dashmul Kadha, facilitate excretion of metabolic waste through sweat, vasodilatation, decreases after load, hence improved stroke volume, and I got remarkable improvement in stroke volume also. Next. Basti. Basti involves per-rectal drug administration with Gokshur, Amlaki, Haridra. So GHA Kada works in Rudrog by breaking the Samprapti. It pacifies the vitiated doshas by its Tridosha Shamak, Vatanulomak, Srotoshodhana Guna and nourishes the Rasadhatu. It improves the Agni and ensures the proper formation of Rasadi Dhatus. Next. Reverse diet plan, it helps in repairing the lipid metabolism, which in turn reduce cholesterol formation and thus reduces blockages and thereby increasing blood supply to the heart. GLS. What is GLS? Global longitudinal strain. It is sensitive marker of subclinical myocardial dysfunction. It is useful in detecting early signs of cardiac dysfunction in IHD patient. Therefore, I think GLS is emerging as a promising tool in evaluation and management of patient with IHD.
Ma'am, please conclude.
Yeah. Conclusion. There was a significant improvement in GLS after ischemia reversal program. Also, significant reduction in patient dependency on allopath medications. It indicates better prognosis in patient of ischemic heart disease. Hence, ischemia reversal program serves as a potent and alternative to standard allopathy treatment for ischemic heart disease. Next, thank you so much.
Dr. Supriya ma'am, if you have any questions for Dr. Swati.
No question, just again a suggestion that every one of you should use. I am repeating this again and again, but you should have something from Ayurveda background also. Like when you talk about Gokshur, you can definitely mention Mutral is one thing. It is basically Kleda Nirharak. So it works on Kleda, and in all these pathology, I understand that we prepare it considering the modern medicine people in front of us, but we should first be clear about why we are using these drugs. So, and quality of life also can be evaluated in such patients, because taking so many medicines, suffering from so many things, the quality of life must be going down. So how your medicines are improving quality of life, that can also be one of the indicator which you can use in the future studies.
Yes, ma'am.
Dr. Romka, is there any questions for Dr. Swati madam?
No questions, but something which I need to highlight over here. The Utpatti Sthan of Am, Kledak, Kaf and Kled is the Amashay. And obviously, the case which you have presented, ma'am, this is a Santarpanjanya Vyadhi, wherein CAD, IHD, DM, HTN, obesity, each and everything is there, which is all due to Santarpanotha, jo hetu hote hai, Santarpanjanya hone ke liye. So obviously, the basic line of treatment over here, the first line of treatment is Ahar. If the Ahar of this patient is corrected, the Rasa to Shukra Dhatu Pariposhan Kram will improve. All the Dhatwagnis will play their role properly, and the Upayojna or Gokshur and all the other dravyas which we have used, these are all Kledahar dravyas, as Supriya madam rightly spoke about. Obviously, see, the first parameter which we need to think about in Santarpanjanya Vyadhis is the abdominal girth. Now, in your case, in this case, 104 abdominal girth was reduced down to 87. That's a fantastic achievement, because the visceral fat, if this has been reduced, definitely you get to see lower down in insulin resistance. Now, insulin sensitivity will improvise. Hence, the HbA1c, initially it was more than 9, then it came back after the treatment to less than 6. GLS has improved from -15 to -20, which is one more positive sign that the treatment is on the right track. And the best part was the stroke volume from 22 ml to 72 ml, right? If you consider the EDV and the ESV and the stroke volume, all these parameters, they are telling, each and everything is telling you the same thing, that if you reduce down the excess fat of the body, if you reduce down the Marga Avarod, obviously the Dhatu Pariposhan Kram will improve and you will see the parametric improvement. Right? So fantastic job. Very nice case presentation. You just need to highlight these points and what kind of a treatment gave you these results. The next time when you present, just emphasize on these points. Overall, fantastic. Thank you.
Thank you, sir.
Yes, Dr. Jean.
Yes, I would now like to call upon Dr. Sonali Gaikwad for a presentation. Dr. Sonali, the stage is all yours.
Thank you, ma'am. Good evening. Good evening, Chairperson.
Yes, ma'am. Please continue.
Good evening, all. Myself, Dr. Sonali Arute Gaikwad. I am from Garkheda Clinic, Madhobag, Chhatrapati Sambhajinagar. Here is my topic: to study the efficacy of 1000 kilocalorie dietary management and Ayurveda-based Panchkarma treatment in obesity. Next slide. Definition. Obesity is a medical condition in which excess body fat accumulates to the extent that it may have negative impact on health, such as diabetes, hypertension, cardiovascular disorders, depression, sleep apnea, and social issue. Latin word obesus meaning fat. Epidemiology, worldwide obesity has nearly tripled since 1975. In 2016, more than 1.9 billion adults over 18 years and older were overweight. In India, about 6.4% of women and 4% of men aged between 15 to 49 are obese. Next slide, please. Need of study, leading cause of health hazardous to many organs. Ayurveda work on it in a multidisciplinary way, that is Panchkarma treatment, dietary modifications, oral herbal medicines, exercise, and yoga. Effect of obesity, as it concludes dyslipidemia, cancer risk, mood disorders, heart disease, reproductive disorders, liver disease, hypertension, and type 2 diabetes mellitus. Next slide. BMI, this parameter is most important in obesity patients. It is calculated by a person weights in kilograms divided by the square of height in meters. It is used to screen for weight categories. BMI less than 18.5 is underweight, between 18.5 to 24.9 normal, about between 25 to 29.9 overweight, between 30 to 40 obese, and above than 40 very obese. Next slide. Causes of obesity: inactivity, obesity, food obesity, lack of sleep, certain drugs like antidepressant, antipsychotic, steroid hormone, sedentary lifestyle.
Ma'am, we could come to the slide of discussion.
Cushing syndrome, thyroid disorders, frequency of mood, dietary patterns. Next slide. Aims have objective to evaluate the efficacy of Ayurveda-based treatment, dietary management on obesity, and to evaluate the effect on BMI, body weight, and prevent further complications. Methodology, this study is conducted in OPD of Garkheda Clinic, Madhavbag. Study span is 90 days, sample size is 20, with the help of 1000 kilocalorie diet and Ayurveda-based Panchkarma treatment. Ayurveda-based Panchkarma treatment includes Snehan, Swedan, and Basti. Snehan, that is with the help of neem oil and til oil. Neem oil is a hamahar, medohar. Til oil is snigdha, ushna, vatakapa shamak. It mobilizes subcutaneous fat, decreases insulin resistance. Swedan, with the help of Dashmulkvat, as it exists, excretes metabolic waste through sweat, acts as a diuretic, reduces edema. Basti, it with the help of combination of path of kulit, gudumar, and nagvel patra extract. Kulit is a apatarpan. It is a kanishta dhanya, which is having apatarpan property. It scraps body fats. Gudumar is a tiktaras katu vipaki, and it decreases overeating. Nagvel patra, it is having pachan, and it decreases satiety. It helps to attain satiety. Results: 20 patients were included for analysis. Out of 20 were males and 11 are females. Next slide. Here is average day 1 and average day 90. Weight reduction from 83.9 to 74.4. BMI 31.92 to 28.4. Abdominal girth 115 to 95. Systolic blood pressure 123 to 190, and diastolic blood pressure 82 to 79. Next slide, madam. Next slide. Next slide. Discussion and conclusion. Panchakarma is a multi-step procedure. It reduces hepatic glucose production. It reduces intramuscular fat deposition and inflammation. Dietary modification: 1000 calorie diet, low carb, low fat, moderate protein. It reduces BMI. Next slide. This study shows significant improvement in BMI in obese patients. About multidisciplinary way is found
to be. I would like to conclude
in BMI. Next slide, madam. Diet is a portion control diet. It decreases leptin resistance. It reduces peripheral and visceral adipose tissue, breaks leptin weight gain cycle. Leptin is a hormone released from body fat, that is adipose tissue. It helps to maintain normal weight and regulates hunger by providing satiety, sensation of satiety. When leptin resistance occurs, it brain doesn't respond it as a normal. Then excess hunger, excess eating, and it lands up in obesity. Where ghrelin is a hormone of hunger, it releases from stomach. And when stomach is empty, it is time to eat, then ghrelin hormone is produced. So here, with the help of negative calorie balance, a person needs to daily requirement is 2200 calorie. Here we use 1000 calorie diet. 1000 calorie produced from internal source of source, that is fat. In a day, 7000 calorie will produce. In 7 days, 7000 calorie, which is equal to 1 kg. So we can reduce 1 kg diet, 1 kg weight within 7 days. So with the help of Ayurveda based Panchkarma treatment and dietary management, we can reduction. We can found reduction in weight, which is which leads to multiple diseases like DM, diabetes, hypertension, and cardiovascular disorders. Ayurveda Panchkarma treatment and dietary modification could be the first line of treatment for obesity. Thank you.
In view of pressing time, we are going to move to the next presenter. I'll call upon Dr. Manjusha Kulte madam for her presentation. Dr. Manjusha, the stage is all yours.
Good evening all. Myself Dr. Manjusha Kulte from Madhava Clinic, Indranagar. Pallavi ma'am, please share the PPT.
1 minute.
Today I'm going to talk about effect of Snehan Swedan Basti with multi-herbal combination on coronary artery disease, a case study. Next, ma'am. My research question: does multi-herbal decoction for rectal drug administration, diet modification help to reverse coronary artery blockages in a known case of IHD with STN patient? Next, ma'am. Patient age 68-year-old male patient with a known case of CAD, HTN, IHD located from Nasik. Occupation travel guidance. Patient has addiction of tobacco and mystery. Come to the clinic with the symptoms of chest pain, dyspnea, vertigo, weakness. Next, ma'am. After all assessment and detailed investigation, patient was diagnosed as coronary artery disease, obesity in a known case of ischemic heart disease patient, ischemic heart disease and hypertension. Next, ma'am. Methodology: after being diagnosed, then advise patient BMP3, IIP2, ischemia reversal care plan. As per protocol, patient complete 21 ischemia reversal program treatment with 3 diet box, which are having high antioxidant, low calorie, high ORAC value. IRP treatment: central oleation, Snehana done with sesame and lavender oil for 30 to 35 minutes. Thermal vasodilation, Svedana done with Dashmul Kada for 15 to 20 minutes. And Basti done with Gokshur, Haridra Amalaki decoction for 5 to 10 minutes. Initially 21 Panchakarma therapies every third day for 3 months. Then 5 therapies of Shirodhara for every week. Reverse diet box is pre-portion 1000 calorie diet box having high ORAC value, high antioxidant, rich source of vitamin C, low carb, high fiber, moderate protein rich in omega-3 fatty acid. Next, ma'am. Advice with treatment and dietary modification and regular exercise of walk 45 minutes, strength training using 2 kg dumbbells for 30 minutes and 50 minutes of meditation. After completing treatment, patient has improved in all his symptoms at chest pain, dyspnea, heaviness completely stopped, no need of any analgesic, blood pressure levels drastically improved, patient feeling energetic, parametric improvement as. Next, please, ma'am. Before treatment, patient weight was 91 kg. After treatment, it was 80 kg. HbA1c is 6. After treatment is 5.4. Before treatment, BP was 150, 100. After treatment, 180, 76. Before treatment, 8 to 9 type of allopathic medicine. After treatment, it's only 1. Next, ma'am. Before treatment, patient VO2 max was 6.65. After treatment, it's 32. Before treatment, patient ejection fraction was 45%. After treatment, 60 to 65%. Before treatment, patient GLS score was minus 16. After treatment, it was minus 20.1. Next, ma'am. Lipid levels before treatment, total cholesterol was 190. After treatment, 154. Before treatment, triglyceride was 176. After treatment, 115. Before treatment, HDL was 42. After treatment, 44.6. Before treatment, LDL was 136. After treatment, 90. Next, please. These are the 2D echo reports. Before treatment, 2D echo shows ISD, left ventricular apical, anterior wall, anteroseptal wall, severely hypokinetic, preserved wall thickness, and RWMA present. After treatment, there is no any abnormalities, no RWMA or no ISD. Next, ma'am. These are the reports of 2D echo. Next, ma'am, please. Patient also done CT coronary angiography with volumetric analysis. These are the reports of CT coronary angiography, in which we clearly seen the soft cloth. That is, before treatment, it was 356.9. After treatment, 2.212. Total atheroma volume before treatment, 358.5. After treatment, 214. That is 40% reduction of plaque within 3 months. Next, ma'am. Next, please. So these are the report of volumetric CTA, volumetric analysis. Next, ma'am. L6. These are the report of L6. RCA. Next, ma'am. Discussion, Snehan Swedan Basti, diet,
Last 1 minute, ma'am.
De-addiction, monitoring of regular exercise with MIV pulse app and timely investigation. Next, please. Next, ma'am. Diet, patient provide a diet with 1000 calorie pre-post diet, which include high ORAC value, rich in antioxidant, vitamin C, low carb, high fiber, moderate protein, and omega-3 fatty acid. For de-addiction, a special mixture of charcoal with jambu with churna. I've used. Conclusion, regular counseling and following dietary guidelines, exercise, Panchkarma, follow-up, allopathic medicine, doses reduction, timely investigation. Next, ma'am. These are the next, ma'am. So de-addiction help reversing ischemic heart disease as well as reduction in dependency of tobacco or mystery. Next, please. With all above observation, the discussion, it can be concluded that strength monitoring, sincere follow-up on diet, exercise, along with Panchkarma procedure like Snehan Swedan Basti can help to reducing coronary artery blockages as well as improving ischemic heart disease symptoms, improve ejection fraction too. Next, please. These are the references from some references for Charam Sahita and others. Next, ma'am, please. Thank you. Acknowledged Honorable Rohit sir, Dr. Gurudatta sir, Dr. Praveen sir, Dr. Rahul sir, Dr. Omkar sir, Dr. Bipin sir, and Dr. Nilesh sir. Next, please. Thank you, ma'am.
Thank you very much, ma'am. Moving on to the last presenter for the evening, Dr. Kalpita Valzade. Dr. Kalpita, the stage is all yours.
Yes, ma'am. Good evening. Thank you. Please share PPT, ma'am. Pallavi, ma'am.
By the time the presentation is shared, Dr. Manjusha, this case was absolutely gem of a presentation because your GLS score of the patient has rose from -16 to -20, and the CT angiography report which you have showed, that has proved that near about 40% of the plaque burden has been reduced. A volumetric analysis report of 144.5 mm cube. It's really superb. Awesome results.
Thank you, sir.
Yes. Yes, Dr. Kalpita, please continue.
Good evening, everyone. Myself, Dr. Kalpita Valzade from Madhavbag Clinic, Sangamner. My topic of presentation is role of Ayurveda-based Panchkarma and medicine in a patient with heart failure with reduced ejection fraction as an add-on to conventional allopathy treatment, a 4-year follow-up study. Objective, heart failure to be a pandemic now, since nearly 26 million people have been affected by it globally. In India alone has around 8 to 10 million patients. Even the mortality rates in India due to heart failure is 0.16 million per year. Hypertension is the major risk factor for heart failure patients. Cases of hypertension are consistently increasing day by day. So heart failure cases are also increasing. Despite availability of extensive list of conventional therapeutic options, heart failure carries poor prognosis. Age of the patient was 52 years, male, having hypertension, complaints of dyspnea on exertion, grade 3, and palpitation. He was not taking any allopathy medicines at start. His pulse rate was 117 per minute. Blood pressure was 190 by 120 mm of Hg. having irregular heart sounds, having no pedal edema. His BMI was 28, non-diabetic patient. Next time. I was advised him to do echo on 17 May 2018. Left ventricular ejection fraction was 15 to 20%. His GLS score was -7, having dilated left atrium and left ventricle. Next, ma'am. Diagnosis: hypertension, heart failure with reduced ejection fraction, and obesity. Next, ma'am. Treatment includes 21 settings of Panchkarma for the duration of 10 weeks, which includes Snehan with Arjun Siddha oil, Svedan with Dashamula decoction, Hruday Dhara with Dashamula decoction, and Basti with Arjun Siddha oil. Next. Diet includes low carbohydrate, moderate protein, moderate fat diet. Salt restriction was advised 2.5 gram per day. Water intake was 1 to 1.2 liters per day for the duration of 3 months. Oral medicines includes Arjun bark extract 500 milligram tablet twice a day after meals. Punarnava root extract tablet 500 milligram tablet twice a day. Exercise includes pranayam 10 minutes daily in early morning. Walking was advised after first 7 days when his blood pressure was normal for the duration of 30 minutes daily in early morning. Next. After 7 weeks, polyherbal formulation of churna, which includes Arjuna Vacha, Patha, Bheda, Dalchini, and Punarnava, 3 gram churna twice a day after meals. Tablets include Gokshur, Haridra, Amalki. 2 tablets twice a day after meals was given along with his allopathy medicines. Allopathy medicines was started after 7 weeks. Next, ma'am. 4-step Panchakarma procedure was continued 1 settings per month up to 4 years. Patient is doing his Panchakarma regularly. Arjuna Shirpa once a day with Gokchur, Haridra, Amalaki tablets twice a day after meals. Some changes was done in Ayurvedic medicines and continue up to 4 years. Next, ma'am. Results: no complaints of dyspnea and palpitation after 7 weeks. At the start, his pulse rate was 117. After treatment, it was 77. Blood pressure was higher. It was normal. Then his BMI was reduced from 28 to 24. Ejection fraction: at start it was 15 to 20%. After 5 months of treatment, it was 25 to 30%. After 2.5 years, it was 40%, and after 4 years of treatment, it was 43%. Next, ma'am. We can see 2D echo reports of patient. At start, his GLS score was -7. After treatment, it was -14. Next, ma'am. And now it is -16. GLS was improved from -7 to -16. Next, ma'am.
Last 1 minute.
Heart failure. According to modern view, heart failure is a chronic progressive condition where the heart muscle is unable to pump enough blood to the body to meet the body's need for the blood and oxygen. According to Ayurveda, Agni is vitiated, metabolic activity is disturbed, there is poor quality of rasa dhatu. Poor quality rasa dhatu goes in the heart, and there is formation of Hridroga. Next, ma'am. Arjuna and Punarnava increases antioxidant reserve. Dashamula acts as anti-inflammatory, analgesic, antiplatelet effect. Arjuna Shirpak strengthens cardiac muscles, improves blood circulation to the heart tissue. Gokshur Amalaki Haridra acts as diuretic, cardioprotective. Rasayan Tridot Shamak conditions Agni. So there is proper formation of Rasa Dhatu, Vatanuloman, Shrotas Shodan. Snehan reduces sympathetic activity. Svedan causes peripheral vasodilation, reduces cardiac workload. Basti reduces blood pressure and strengthens cardiac muscle. Exercise improves functional capacity, and it can improve Koshtagni as well as Dhatvagni, including Rasa Dhatvagni. Conclusion: Ayurveda-based Panchakarma and medicine are effective in a patient with heart failure with reduced ejection fraction as an add-on to conventional allopathy treatment. This non-invasive Ayurvedic regime can be considered as good candidate to be included in maintenance treatment of patients with chronic heart failure. Thank you, ma'am.
Thank you very much. As we come to the end of the session, I would like the chairpersons to share the scores with me on personal message. By the time the scores are being tallied and we are ready with the winner for the evening, I would like Supriya ma'am to share some words with us.
Yes, and Dr.
Actually,
Kalpita, that was a fantastic score of GLS from -7 to -16. Supreme, ma'am, I'm just taking a minute of yours.
no. You please go ahead.
Yes, Dr. Kalpita, EF
Yes,
of
sir.
15 to 20% on the first day, and till 4 years, you have kept the patient under your observation and treatment. Really hats off to you, because
Thank you, sir.
this takes a lot of courage and bravery to have that patient with you, associated with you for such a long period. And the GLS from -17 to -16, super, super.
Thank you, sir.
Yes, ma'am. Supriya, ma'am, please continue.
Yeah, so I was saying that I have already shared my general suggestions and comments in view of the time. Uh, it was a great evening for me, and I enjoyed each and every presentation. I have just given few suggestions to make them better, and I'm sure that when third NACS will happen, these suggestions will be considered and implemented as well. So thank you very much.
Thank you so much, ma'am, for your valuable suggestions and the points which you have made during these presentations. I think obviously all the doctors over here, the researchers over here have taken these points very well, and definitely in future, all of them will improvise on the points.
Thank you. Thank you.
Most definitely. Dr. Rahul, sir, would you like to share some words with us?
Yes, unfortunately, the good thing has happened. The power has cut down. I think my society people also don't want me to continue speak more right now. Like, so definitely, very nice presentations from all the presenter, and Dr. Supriya ma'am, as you are a teacher of mine, you taught the presenters also very well, and I'm very thankful to you and Dr. Omkar, the way you have handled the session with a very patience, with a I can't I can't express that right now in the words, but I can understand. Understanding the clinician's language when you are sitting in the chairperson seat. So it's very kind of a difficult, because we know the researchers, when we are giving the research, we try to incult all the aspect of the clinical research or the research part, and when the clinicians come into the picture, they are more emphasizing towards the result, ki how I given the results. So I think this is the major difference, and that will always remain. The sorry, the academicians and the researchers, they will be sorry. So academicians and the researchers, they are, I think, two sides of a coin, and the this kind of a conferences is a bridge to make them connected, keep them connected together for always. So thanks a lot, all the presenters, and thanks a lot, Dr. Supriya ma'am and Dr. Omkar sir. Me and Supriya ma'am were discussing, maybe in the future we will be running, because Dr. Omkar is also is the head of the learning and development department. So we will be starting a series of knowledge of on the research methodology for exclusively for the clinicians, and maybe monthly once we will be having a session of Dr. Supriya ma'am, and she will be guiding us ki how a clinician can be turned into the researcher, because in the future we have to go to the bigger platform, maybe the like World Cardiology Congress or the World Ayurveda Congress. So on such platform, we should be equipped with the skills and the knowledge of a good presentation practice, what we can say. So definitely both are here. Dr. Omkar also here, and Dr. Supriya ma'am is also here. So I request both of them to uh, prepare some module of research learning of research
Sure.
methodology that will definitely help our doctors, and definitely that will help Ayurveda. I'll rather say that will help Ayurveda, because such a results has to be taken to the global platform, and only the clinicians that can do that with better skills of presentation. Definitely we can take Ayurveda to the first line treatment option. And that's all from my side. Over to Dr. Jinal. I hope you are ready with your results.
Yes, sir, I'm ready.
Great.
So I'm sure everyone is very excited to know the results. And I'm also very happy to announce that we have two papers at a tie. The best presenters today evening were Dr. Arunima Yadav and Dr. Manjusha Kulpe, ma'am. Congratulations to both of you.
Congratulations to both the doctors. Superb.
Thank you very much.
Just a minute, I'll spotlight both of you, Dr. Manjusha and Dr. Arunima. Dr. Manjusha, if you can just keep your cameras on. Just a minute. Yes.
Yes. And
congratulations to both.
Thank you.
Congratulations, Dr. Arunima and Dr. Manjusha. Yes, Supriya ma'am, we are expecting your kind words.
No, I was just going to say that I enjoyed it. It was like a family get together, and everybody was congratulating the person after presentation. Everybody was cheering up, so it was like being a part of a family. And thank you for inviting me to this family today. Thank you very much.
Thank you. Thank you so much, ma'am. Your points are valid, and definitely in future we will try and improvise ourselves. And the points which you have mentioned in the chat box, really those are quite valuable feedbacks from your end. Thanks a lot. Thank you.
Right.
With this, we come to the end of session 4 for day 3 of the second National Ayurveda Cardiology Symposium. Thank you everyone for being present. Thank you both the chairperson, and thank you also for giving me this opportunity. Good night, everybody, and adios.
And thank you, Jinal. Since morning, you are very cheerful and very wonderful, and because of you, the entire session was very lively. Thanks to you and Pallavi once again. Pallavi is sitting behind the scene and operating all the presentations. So thanks to both of you. And thanks you all, and see you tomorrow right at 3 o'clock, because Dr. KK Deepak from the AIMS hospital is going to chair the session along with Dr. Bhaswati from USA. She will be chairing the session of tomorrow 3 p.m. So I expect you all to be there on time. Okay, so good night and stay tuned for tomorrow. Bye-bye.
Thank you so much all. Bye-bye. Take care. Dr. Jinal, superb. Hats off to you. And Pallavi, superb. Thank you.
Thank you, sir. Thank you.
Thank you,
Supriya
Rahul.
ma'am, thank you and good night, and we will discuss हम लोग अभी ये कैसे सीरीज आगे लेके जाए. Bye bye.
Thank you, Supriya ma'am. Bye-bye. Good night.